Good morning everyone and welcome to this Professional Students Summit. Professional Students Summit PSS is an intervention that was started in 2019 on the direction of the Honorable Chief Minister, who felt that students should have exposure to professionals who have risen to height in their chosen field due to hard work and integrity. The idea is to motivate the students to excel in whatever they do, stand up and seize the exciting opportunities that are arising in the state and the country and create jobs and wealth without losing sight of ethics and constitutional value. The summit is an opportunity for us to come together and share our experiences, knowledge and insight about the nursing profession and its future. We have the distinguished group of speakers here today who will be sharing their valuable experience and expertise with us. Over the course of the day, we will be hearing from our speakers about the latest trends and developments in nursing field, as well as their perspective on the future of nursing and the opportunities and challenges that lie ahead. I have no doubt that this summit will be an inspiring and educational experience for all of us. I encourage you to actively participate in the discussion, ask questions and engage with our speakers and each other. In today's meet, we are honored with the esteemed presence of few dignitaries who will enlighten us. Firstly, I welcome Dr. Latha Venkatesan. Dr. Latha Venkatesan is highly qualified and experienced nurse and educator, serving as a professor and principal of College of Nursing at AIIMS, New Delhi. She holds numerous advanced degrees in nursing, health management, counseling and acupuncture, and has 32 years of experience in clinical, education and administration. Dr. Venkatesan is well respected in the field, having served as an assessor for NABH, a Lean Six Sigma Green Belt, and a committee member for the development of nursing standards. She has also served as a Board of Studies member for universities and is a guide for PhD students. Dr. Venkatesan has received numerous awards and is an active member in various nursing organizations, including the Clinical Nursing Research Society and the Association of Nursing Education in India. She is highly accomplished in her field and has received recognition for her work as a teacher, nurse educator, principal, nursing leader and researcher. Welcome, madam. Next, I welcome Professor Selva Titus. Professor Selva Titus Chacko is a seasoned nursing professional and academician with 40 years of experience in nursing education and practice. She holds a BSc Nursing, MSc and PhD in Hematology Nursing and has held various administrative positions at CMC Vellore, including Dean of College of Nursing. During her tenure, she established partnerships with universities globally, including exchange programs for faculty and students. And the college was designated as WHO Collaborating Center for Nursing and Midwifery twice. Dr. Chacko took a 3-year study leave from CMC Vellore to obtain specialized training in oncology and hematology from South Australia. Upon her return, she established a bone marrow transplantation unit and trained students and staff in oncology and hematology nursing. She has served as the Vice President and President of Nursing Research Society of India and was the Chairman of Nursing League at Christian Medical Association of India. Currently, as the Dean of the College of Nursing of Gulf Medical University, UAE, she is a member of the National Committee for Nursing Midwifery Affairs, a National Task Force Committee member for Nursing Education and Professional Development, and a Commission for Academic Accreditation Reviewer. She continues to promote value-based education and the integration of nursing education and practices, especially in cancer care in the UAE and abroad. Dr. Chacko is a passionate teacher who work towards integrating nursing education and practices, mentoring students and empowering faculty and staff in the hospitals. I welcome all the faculty coordinators, students from all nursing colleges near and far for the Professional Students Summit. Once again, welcome all to this Professional Students Summit, and I wish you all a productive and enlightening day. Thank you. So without much of delay, we will go ahead with the sessions, and we will start with Professor Selva Titus Chacko, and I request ma'am to enlighten us with your words. For that, we will just move the chairs down, and my team will come and help. Thank you.
കുട്ടിക്ക് കളറും വൈറ്റ് ആക്കും കളർ ഡിമ്മാക്കിയാണ് കുട്ടിക്ക്.
See all of you, and it's a pleasure for me to be invited to speak to you, to sensitize you, to share my experience, in fact my life, so that if you learn something out of it, it's an inspiration for me. ആർക്കെങ്കിലും മലയാളത്തിൽ എന്തെങ്കിലും ചോദിക്കണമെന്നുണ്ടെങ്കിൽ ഞാൻ ആകുന്നത് ഞാൻ പറഞ്ഞുതരാം. Okay? You're most welcome to ask any questions. This is just a startup to say how I have come into this profession, what I have been able to achieve, or how God helped me to achieve, and if that will be a motivation for you. This professional student summit is only to cause a sensitiveness and an inspiration for each student in different field. Am I right? So I hope it will be an interactive session. I have typed most of it is pictures, just to show you. Title my talk as Healing My Passion. And I have written nursing an unpredicted switch, yet rewarding and satisfying. It was something that I didn't choose, but I chose something else, and because of that I was in nursing. And I want to say it has been extremely satisfying after 40 years of being in this profession. Okay. Now, what is an enigma? An enigma is, you're not sure how things will roll out. You're not clear. You don't understand. That's how all of you are. You're in the profession. You don't know what you're going to do, what will happen. But there are so many factors in your life. You have something that you're good at, and maybe when you do something, someone will pay for you. It may be something that you love very much, and you have this profession which you may be passionate about. You call it as your vocation, you call it as your mission, and this may be what the world needs. This is the enigma. You have all this, you're not sure what you are in bits and pieces of this, what you do with your life. This is what all of us are at every moment. Now, you want to now think, you have joined the profession, maybe you came on your own. Maybe your parents thought this is a good profession for you. Maybe you didn't have a choice to choose something else. Maybe you just didn't get into medicine or whatever, But please make it your passion and your vocation. It's time now to be in that. I think most of you are in your second or third or fourth year, so you must make that into it. So it's all about choices. What is passion? Passion is you have some desire in you to do something. I want to be helpful. That is passion. Now, how to be helpful? You have to choose a vocation which you have already chosen. Vocation is Okay, this is the pathway. That is, nursing is the pathway by which I am going to be available, and that direction you choose. Now, why we have to do that is societal reformation and moral higher ground shape the vocation of many noble people. So, when they had a passion, when they had that enigma, and then they had a passion, and they made it a vocation, they realized that people who went by their dreams, by their passion and by their vocation, they made so much of difference. Now let me show you some examples of people. There are different people, I am not going to elaborate on this. Each of these people in history has made tremendous contribution to the society by moving because of the passion they had in helping people. Each one of them. Some of them even lost life. Jim Elliot, for example, in his passion to help others, became sick by himself and he died. When David Livingstone is a physician and he decided he's going to work in Africa because people there did not have a doctor. He also lost his life there, but he made a tremendous contribution for the improvement of human mankind. William Carey is the same one. He is the one who articulated how each one should be in his life. Now I put in this person's picture, Ida Scudder. Probably you've heard of her, but or not. She is the founder of Christian Medical College. She was an American young girl. Her parents were working in these poor areas in 1800s as missionaries. But she, her life got touched and she came, and today CMC Vellore is world renowned. So what I'm trying to bring it to you is, we may not become such big people, but we can, and we can make a difference. Okay, let me just now, what is your vocation? I want to know. You all are in nursing now, all of us are in nursing, right? Now why we call this as a vocation is what you're passionate about and what your calling is. Many of us believe in God and we feel that God has called us to do something in life to be useful, and that becomes what the world wants. Today if you look at, WHO statistics, it's at the moment we are 6 million short of nurses. Now COVID-19 has made 9 million. By 2030 it will be like that. We are most wanted, not only in India but everywhere, but more so in this country. So I want all of us to think that I am a person who is passionate to help human mankind, and my vocation is nursing, right? You are in here, I don't know whether I'll still continue. When I finish, I don't know if I want to be doing this. There may be so many of us confused. You can do many things related to this so that you will make a difference. Now, this is the best definition I've had about vocation. Why am I taking a few seconds to talk to you about vocation? If you don't believe that this is your vocation, you will not make a difference to the world, to the society. So this is the best definition. The best definition I have heard of a vocation is that it's the place where your great joy meets the world's great need. We need all of you to find your vocation and to develop your passions and to match them to the world's greatest need. So your life was made for it and your soul will depend on it. So I trust and pray that all of us make this as your vocation. As I said, I can vouch after 40 years, not once have I thought I will quit nursing. There have been difficult times. I'm not saying no. There are times I thought, oh no, nobody is listening to me. But that happens in every profession. But next day, I pull myself up and say, I can make a difference in my own small way. Okay, let me go. So this is what, so then in my decision of a vocation of nursing, healing became the ministry that I am going to need. And I want to tell you, healing, every other profession that we look at, except for healthcare needs, people come to us. We don't have to go to them. An engineer and others have to go and market themselves out to make something. But here, people are coming to us in the most vulnerable situation. Whoever it may be, they can be the top in the country, they can be the lowest. They are coming to us in the most vulnerable. They are helpless. What an honor and what a privilege. So that is our vocation now in being available. So this is what I want you to tell you. Many people walk through the portals of hospital than through churches, temples or mosques. Isn't it? And what do anybody fear in life? Oh my God, I don't want to be in a hospital dependent on someone. But today, if you look at, but many people walk through hospitals, and you are there. We are there. Than this. Keep this in your mind as healing ministry. So then, what about nursing? One of the aspect of it is nursing. Okay, whole people call us gifted, called, blessed. You know, we are so blessed to look after people. This is our profession, and people keep telling us, you are the only one who is 24 hours, which is very true. Very, very true. Any other health profession you compare, they come and walk out and walk. I can tell you out of my experience, I will share with you. You know, we are the one who identify bits and pieces of this person called human being. Every aspect of that. We are. So when you are a nurse, you know that every day you will touch a life, or a life will touch yours. As Mercy introduced me, I went on to do hematology nursing. I realized life is transient. You're here today, you're such on top, you just had a fever, you went and took a cupboard of Panadol, nothing happened, you went to the doctor, you checked your blood, you have leukemia. That's it. Doomed. That's how life touches us, and that's how we are going to touch their life. At that point, how are you going to touch others' life? This is what you have to remember. So now this is where I am coming to my life. It can be a figment of imagination. What is figment? You think, oh, it just happened by accident. It just, on a process of my life it happened. Or you can think it is God transforming you. In my life, it was a transformation from God. Because I believe in God, and I trust that my whole life I've been ordained to do something. And that is how this happened in my life. Whatever it is, you will make a difference. So 3 ideas came into my mind. When I was thinking about pondering on what I should do with my life of healing, first of all, I should be willing. If I am interested in that. So that's why I brought this idea about passion, about vocation, right? So first thing, I should be willing. I should be willing to go through anything. Secondly, it's whatever I do, it should be welfare of the society in general. But on the most, make sure that you are looking at the wellness of mankind. When you say wellness, they may not physically heal and go. I worked in an area where I saw more deaths than life. People ask me, don't you feel like running away? Every day you're taking a stress of someone small, someone in the prime of life, you're losing them. But I just think, if I can make that pathway of their going, all of us born will end at some time, and make it possibly easy, and make it a comfortable experience for them, I have addressed the wellness of that individual. So this is the 3 areas that I thought I must focus on. Now, so as I said, this was the thing about will of the individual. It's a beautiful thing when your career and your passion comes together. Your career and your passion must come together. Then it's a beautiful thing. So this was the will that I had. And secondly, it's not moving. Okay, welfare of the society, I won't go into too much. I already mentioned that to you. This thing. Okay, and the wellness of mankind. So this is where 3 things. Then now let me move on. I wish it would just quickly do. Okay, now I will say an unpredicted switch. At this point in my life, I had not chosen nursing. All I wanted to do is, I can tell you, testify. I come from a Hindu background and I accepted Christ. I wanted to be a Christian. I wanted to study in a Christian institution. Okay, I got into medicine in Coimbatore Medical College with being the best outgoing student in my college. My parents were not very happy when I said I want to go to Vellore, because at that time, I'm talking about 40 years, there were not many private medical colleges, and getting into medicine is like the thing in that world. But my only determination was that I want to be in a Christian institution. So I don't know anything about CMC Vellore. Just that I got in, I was one of the 4 open candidates there. I went in there. But I can tell you, life was transformed because of that. Every moment people ask me, my children, everybody know that I would have never made a good doctor. I would have never made a good doctor. I am very, very happy as what I am today. So sometimes people call, you can call it, many of your life may resonate with what I am saying. Maybe you didn't want to, you want to do something else. Maybe your parents pushed, maybe your brother or sister who's abroad said do this so that you can come to America or whatever it is. It may be an unpredicted switch, but life can transform you. Now what transformed me is two things. Interaction with students and my hematology and oncology specialization. Those two things in my life really made my life to be what I am today. So you have to make the right choice. It will work in it. Okay, so now coming to CMC Vellore. I really want to thank this place. This place is what helped me transform it. Okay, if I have become something, it's because of this place. If I can keep the laptop, I can be quick.
എടാ ലൈറ്റ് പൊട്ടിക്കും കൂടെ. ആ ഇരിക്കട്ടെ.
So I want to thank this institution where I went. Okay. Now I'm going to switch to some other thing. What made difference? Now today, if you look at nursing in our own country, to a greater extent, education, practice, and research is separate. We call it, no, we are there, we are going, and all that. But if you look at, it's all in a silo, right? Our forerunners, and we keep bullying each other. Who is big? Is education big? People in practice say, are we big? And researchers will say, no, we have all the knowledge under the sun, right? So this is who's the biggest bully. But you know what happened is our forerunners in CMC Vellore, they thought together and they decided that this is not working well. Those who are teaching should be leading the institution. They will be the one to do the research also. So then we can make a difference to nursing. And I want to tell you, this has been going on for the last early 1960s they did this. I think I was just about born or going to be born. That time they did that. It was very difficult to bring everybody together, but they tried it as a pilot study. But they continue on even today. And I want to tell you what made difference to me. What I want to tell you today, you must have heard Professor Ella speaking, right? You have to stick your neck out, he said. Am I correct? So, if you want to become the change, our own father of the nation said, you have to see the change and you have to be the one to make the change. ഞാൻ മലയാളത്തിൽ പറയാം പല പ്രാവശ്യം നമ്മൾ നഴ്സിംഗ് പറയാറുണ്ട് നഴ്സിംഗിന് വന്നു കഴിഞ്ഞാൽ നമ്മളൊരു ഫ്രോഗ് ഇൻ ദ വെല്ല അത് കഴിഞ്ഞ് വെളിയിൽ ഇറങ്ങില്ല അതിനകത്ത് തന്നെ ഇങ്ങനെ നീന്തിക്കൊണ്ടിരിക്കും It's a problem. Am I correct? You're so talented, you sit with everybody in the same college, in the same school, you come into nursing, you don't do anything else. You're just stuck in there. If you want to see a change in your profession, you should be the one to see the change. And that is what is very important. And then I learned one thing when I was there. Nursing education without practice is like a cup of tea without sugar. I don't know how many of you like tea. In my age, I have to not add sugar. I'm old. But we don't like a cup of tea without sugar. It's bitter, it's not nice, right? Then it is good, not good if we are not together. So they thought like that, and they, like a turtle, they stuck their head out and said, we're going to make a change. And I can tell you today, if this institution is standing tall in this country, it's because of somebody stuck out their head out. And the beneficiaries are people like us. And it's my mandate to sensitize each one of us. So how does this work? Just look at this. We have a dean, we have a nursing superintendent in the hospital. Am I right? Both are equally qualified. Both are faculty, both are also service people. We have a deputies on both sides. They're also professors. They're also working on either side. It's all administrative board. We have heads of the department. We have 12 heads. I was also one of the head of hematology nursing, but I was also dean at one time. This can be a switchover plans. And you have a role in the college, you have a role in the hospital. My hematologist doesn't see me, one day he will say, Selva, where are you? Right? So that's the way we functioned. Okay? We have education and research on the role of a college, and you go and take your lectures, your students, your batch, everything you have. But also I am a nursing management in my department. My students don't see artificiality. The same teacher is there. You can't tell the people there, they didn't teach me in the class. The same teacher who is there. Students very easy. So then they were like that. Then all the faculty are also called nurse managers. They have a master's and they are responsible for both ways. So education, research and lecturing here up to lecture to professor, management and supervisors. Then you come, the charge nurses are there who are also BSc, or it can be a tutor on either side, patient care and staff nurse, and so you can see this whole thing was integrated. This is the model that I got into when I went as a student. That's why I thank God for Vellore. And today this model is there in WHO. I told you we were a WHO collaborating center. They called me to present this model there. How it works. Because nobody can think that you can do so much. How does it work? As you grow, your proportion that you spend time here and opposite will change. You understand? On one side, you may be spending more time. Can you please sit down? Can you please sit down? I can't see. Okay? So, on the other side, it will change. So, this is how this model went on. Now, having said that, I will tell you my enigma. Okay? What did I say enigma is? I don't know how it will work, isn't it? Like that. You're thinking, I want to do something in nursing education, what can I do? But I don't know how it will all come. So I will tell you mine. What I want to tell you is I'm just showing pictures so that it will inspire you. This I went on in the same process. I studied there, I did my masters there, I continued as a faculty in the same college. Okay, this is the first college in 1904, 45, even before independence, the School of Nursing. And this is the first college of nursing. It is one of the first in the country. And this is the college building that I studied. And we started PhD much earlier. And this is the new college which I was there for the inauguration as a dean. Okay, so in that journey of my life, I have been part of this whole process of planning how it should be. Today, we have a beautiful independent college of nursing. So I already showed you these pictures. This is today's College of Nursing. Okay, we have a separate building with all facilities, with all labs, whatever it can be, so that you can make a difference. So I have been teaching students, I also have been practicing. Now let me come to the hostel facility. This is the first hostel that the students had in those days. This is called Glass Palace. This was one of the tallest building in Vellore when I studied, and from Katpadi station we could see, we call it Glass Palace because we lived there, but today this is the hostel. Twin building, UG and PG. I was the dean. Okay, UG block and PG block. I was there for the inauguration. What I am saying is, I didn't think I'll do nursing. I was one of the 4. I just switched off wherever it was. But today I'm able to be saying that among the 10 deans who have passed out, my name is also there on the board. As Dr. Ella said, it's not about bragging yourself. What I'm trying to say is, if you are sensitive, and if you are passionate, and if your vocation falls in, you don't know what opportunities will come in life. You're so driven that you will do the best. Now let me come to, this is just inauguration with everybody. Just pictures, I made sure the students have gym, physically fit, they have a school ground, and they also we made a chapel in our campus, which is a prayer place for them, and we also made for ground and everything, so separate, and we are still top nursing college in the country. And all this is working together, education, practice and research. People ask me, are you in education or are you in practice? I get confused when they ask. I don't know what to say, because I am both. I'm also part of research, okay? Now let me come to the next verse. This is just a picture of all the senior faculty with the nursing superintendent and the dean sitting together, because she's also a professor, I am also a professor for a term. And this is a picture. This was taken in 2018 with all my faculty. You can see they're all in uniform. Why? Because in the morning they're in their own hospital, they are the nurse managers, they also come for their classes, right? Now let me talk to you about my enigma in nursing, practice and research. You don't have to be skewed to one life, you can do to other things as well. So what did I do for practice and research? Institution realized that we need a good hematology center, okay? And they asked me, because I was working in that area from the time the hematology department started. I was the nurse manager there, by work I had. So they said, would you like to go and train? We want you to go and train and come. So I went to Adelaide, South Australia, and did 3 years of oncology and hematology training and came back, okay? This is the team. I don't know if you recognize, can you see Dr. Maman Chandi there? Have you heard of him? Padma Shri. He's the first person who did bone marrow transplant in the country. Okay, this is my team and I was working with him in our team. Now, during my period, I always say I was very, very fortunate to make many buildings in ECMC. There is a 400-bed A block which was built with our plan, with my plan in it. Sometimes people say I've become a little architect. Hospital architecture I have learned. So this is a building. Why I'm saying this is, can you see this stem cell transplant unit? This is the map of the stem cell transplant unit. It's a 30-bedded transplant. I can tell you, nobody else will know about the patient need as much as the nurse. She will know where the sluice room should be. I'm not talking about other rooms. Sluice room should be. Where the patient door should be. How big the door should be. How big a patient cot should be. How big relative cot should be. So this is a transplant unit that was planned with me because when I was in Australia, I learned about planning stem cell transplant unit. This is a 30-bedded transplant unit where we have for autologous 10, allogenic adult and 10 for pediatrics. Okay, I learned things in Australia and I realized that we have this feeling what we learned abroad we can't put it in this country. Yeah, maybe not all. You have to geographically change your standards. What is possible with the same principle? So every principle in terms of transplant, in terms of what kind of monitoring each healthcare worker should do to make sure that no infection is transferred, how people should enter, washing feet and screws and other things, even showering with microfilters so that 0.03 micron, no water which has got things will come inside. UV light to radiate all the water that comes from under, and also biosafety cabinet. All this with our principle. Even today, I can tell you every hematologist in this country was trained under Dr. Maman and other team. And all the people even in Kerala, RCC, Amrita here, so many places, Rajagiri, all these places I have come physically to teach and train how to do and how to look after people. And people have come over there to Vellore as well. So you have to adapt something that you learn from somewhere to your geography. Next I want to tell you, I learned that line care, all patients with hematology will have these central lines put in, and the suture site is the biggest infection rate. Our rate at one point when I came from Australia was 11.6%. Okay, we did a huge study, 1,500 patients randomized, doing 2 types of dressing without suturing, and we had a separate team of nurses doing it, and we found the infection rate came to 5.6, which is parallel to the Western world. There so outside is not as dirty as ours, right? And we reduced it. So much so that nationally it got adapted, the dressing that we have done. If you take one patient dressing, you'll find, can you see this with the strips that is being put? It'll be same, no sutures, only that many number of micropore. And that's how we did. It's simple, but a nurse can do it. I taught the whole infection control team in CMC Vellore, all the ICUs, medical ICU, surgical ICU, neuro ICU, how to do this dressing so that you can bring in the infection down. So what I'm trying to say is that if you have a passion and you have a focus, you can make a great difference in your life. So this is just to show you that I was in Cochin in 2018 for the Hematocon, which happened in the Lulu huge conference center, right? So we were there teaching the whole Kerala hematology nurses how to do this part. We had a stem cell survivor meet. We started the first bone marrow transplant in 1986. In 2019 with Dr. Maman, after he got his Padma Bhushan and Padma Shri, we had this, and we had patients who have survived, children who have survived, become big, married, making a life. There's one patient who became a hematologist herself because she got her life back and she wanted to give back. So it's a satisfying moment for all of us. So what I'm trying to say is, just to tell you that you can make a difference. This picture I put because, can you make out somebody there? Chief Minister K. Karunakaran? Yes? He was admitted in A ward. You know why? Because they thought CMC nurses give good care. I'm just joking. He was there, and this is a picture with him in my ward, that A ward that I spoke about. Okay, so now let me come to serious business. A few things that I want to inspire you. How do we achieve these goals? If you ask me, did I plan for it? No. It fell for me. If you are focused, things will fall for you. But how do you achieve this? You have to be willing. You have to be willing. Willingness comes first. Hard work and attitude. It's not easy. Life hasn't been easy. When people don't follow, medical people don't follow the protocol that I have set in bone marrow transplant unit, I have walked to my consultant team head and said, I will not run this if your people don't follow. You have to stick your neck out and stand for what is right. Okay? That's very important. Today, Mr. Ella also said, you have to be knowledgeable. Very often we say we are not recognized as nurses. Are you knowledgeable? about the area that you're working, about the science that you're taking care? Do you just only do passing on the results, or do you interpret it and tell to the doctor there is something wrong? Because you're the one. And sometimes the junior people will say, no, you don't know. No, you don't know. I know. Make a command of your place and position. You can make significant difference in what you're doing. That's important. And one thing today he also said, everybody, you remember he said, whoever lost business he has taken in, isn't it? It's human to make mistakes. That's why pencil and eraser is there. Don't feel, oh, I am not good. Erase it, move it on. Things will work. It will work. I'm telling you, it will work. Look at Florence Nightingale. She was just not a nurse. She was a writer and a statistician. That's why she reduced infection then, right? She stuck her head out. And this quote you must remember. I attribute my success to this. I never gave or took any excuse. She became the founder of modern nursing. Am I right? And we follow her. What an image she had. What an image you can create. What an image I can create. There's a whole world of opportunity for you. So I want you to remember this. I want you to remember optimism is something that you have to have. If you are optimistic, sometimes if you are optimistic, you can become a pushy person. Am I right? Yes, people don't like to be pushed, but sometimes you have to push. If things have to work, because we cannot work in silo. So world is like a mirror. If you face it smiling, it smiles right back at you. And this is one picture I like. We are everywhere of life spectrum. There's a saying I've seen. The nurses are like an angel. When eyes open, you're there, and when you're closing also, you're there, right? In my life, I've been there more when they close life. But at the end, the patient's family say, thank you so much for making it so pleasant for all of us. That is the most gratifying opportunity for all of us. Now I will give you a little bit. Second inning. I have finished 60 and I can sit veetla parayla kaali neeti irikkunna samaya alle. Have you heard that? I have heard people say kaali neeti irikkunna samayathu chaadi nadakkuva. If you have the energy, do it. So I'm trying to say my second inning. What the enigma? I got invited to this university in Gulf McGill University. Why? Because they believed in integration. This university picture you can see, center is university. Both three sides, there is a rehab institute, there is a dental hospital, and there is a 350 bedded hospital. That was my passion, integration. Immediately I jumped out and I took on to this university. Now I'm working as a dean. You can see that I'm the only lady there. But it's okay. I'm short, but I'm tall in that. I'm just joking with you. I'm short, but I'm tall in the sense I put my word. I started hearing people saying, Professor Selva, if she says something, she will stick to it. Why I'm saying this is, you stick to what you are saying. If you believe strong, you should be knowledgeable, you should be convinced, you should have the value, you will stand for what is right. And this is the College of Nursing. Just a picture to show you. This is, what, I am now the interprofessional committee chair of the university. That university has got 6 colleges: medicine, dental, pharmacy, health science, nursing, and healthcare management. We students are learning together. This is called a white coat ceremony with all the students. Okay, all professors are divided into different interprofessional groups, and they have regular first year interprofessional classes, and final year they work on a patient together. So now it has become, because you have team member at the end, right? So there is a picture with that. So this is just to show you that I've become the national committee member for nursing and midwifery representative, and the person who is in an Arabic attire is the vice president of the country. So continuity with change. You keep moving your life with change. What can I adapt? What can I do? How much can I be useful? And then your life will be very, very satisfying. And growth is never by chance. It is the result of forces working together. As nurses, you just imagine 80% of every hospital healthcare is nurses. What a difference we can make. We should not come together for wrong reasons. We should come together for right reasons. That's very, very important. So my parting words with you. Nursing education and practice is just like the two banks of a river connected through different models. Okay? If you're feeling you're left alone, you're silo, make a difference in your place. And because nursing is a complete profession, unless something they see tangible, that's why they call skill. Today everybody talking about competency-based profession. I have known in my experience, all best outgoing students are not good nurses. Okay? And all average nursing students, by knowledge, is not poor nurse also. So these both have to balance. I'm a bright student, but I'm also a very skillful hematology nurse. I don't know anything else. I only know hematology. That's my part. Similarly, you find your niche in life. What are you good at? So, as nursing, my dear students, determine who you are. What do you want to be? Don't think that you are lost in the world. You've got so much of opportunity right in front of you. So, this is a question. Am I a nurse who can only theorize, that means only padikka matra pattuvo, or am I a nurse who can theorize and categorize? That means you have to be good at your skill as well. So they say that time changes things. No, you actually have to change them yourself. Have you known this lady? Have you ever heard of this lady, Loretta Ford? Go read about her. She was the first nurse practitioner in 1965. And this is a quote she writes. 1965, she came out with this. Okay, she's the one who wrote all about nurse practitioner. She says, I've been there, I have done that. And she laughs. I'm also saying, I've been there, I've done my part, and I'm laughing. But your timing for change and experimentation couldn't be better than this. And this state is so well promoting for change and bringing skills, bringing excellence. So if you think nursing profession is in chaos today in your state, it's an opportunity for you to change. I don't know how you can read it, but I will read it. I want to leave this for you. First thing that should change is your attitude. The longer I live, the more I realize the impact of attitude on life. Attitude to me is more important than facts. It's more important than past, than education, than money, than what other people think or say or do. It's more important than appearance, giftedness or skill. It will make or break a company, a church, a home. The remarkable thing is we have a choice every day regarding the attitude we will embrace for the day. We cannot change our past. We cannot change the fact that people will act in a certain way. We cannot change the inevitable. The only thing we can do is play on the one string we have, and that is our attitude. I'm convinced that life is 10% what happens to me and 90% what I react to it. And so it is with you. We are in charge of our attitudes according to Charles. So, nurses are appointed ambassadors of God to bring wholeness for the life of people. It's up to us to take that. I strongly believe in that. And so let's do our best in whatever we are called to. And it's not about what you achieve. You know, you can say, I am a president of this, I am that and this. It's about how many people's life you touched. Okay? God doesn't call the qualified, He qualifies the call. This is a verse from the Bible, so I want to put that for you. So the highest vocation we have is love. Nursing and love is always compared. Am I right? Yes? Love is action and service in nursing. Thank you very much. And if I've inspired you,
we will have 2 to 3 questions you can ask Professor Selva Titus. So the mics we will share, circulate the mics with you. You can just ask questions, 2 to 3 questions, okay? Later on we can have further talks. Right. Anyone wants to ask?
Good afternoon, ma'am. So I'm Anand Roy from Jubilee Mission College of Nursing. My question to you is, what's the one quality of the nurse you thought that's the best when you joined your career, and after 40 years of this much experience, and what's the thing you know that this should be the quality, and after 40 years of age, 40 years of experience, before and after, what's the one quantity or quality that you think a nurse should have?
Okay. If I can't put them 1, 2, 3, but I will just tell you. When I joined, everybody said nursing is all about caring, right? Caring for another person with love and so on. But to me today, caring and loving is absolutely important, but more than anything else. I re-emphasize, I overemphasize, integrity is an absolute essential quality a nurse should have. Why am I saying this? Integrity is something that your truthfulness to yourself of what you're doing. If you're not truthful in what you're doing, why? Because every other profession, they have a chemical or an instrument to work with. If they drop it also, it might break, you can replace. But if you are not truthful enough, your laboratory is human being. Yeah? Am I right? So integrity, if you have done it, you say you have done it. If you have not done it, you say you haven't done it. You might have, repercussions because of that, but you are you're truthful what you have done and you have not done. So to me today, I will not undermine caring and love, but I have determined that integrity is absolutely essential. I will give you one simple example if you mind. There was a student who worked with me when I was a student. She was from the diploma nursing and we were just rushing for a clinical presentation, trying to finish all the work. We were in a cardiology ward, pre-operative ward. We used to powder, digoxins. Those days small digoxin used to come in small pills. She powdered and gave and she was going to record. The dose written was 0.5 milligram. She already got procedure signed to give the administration of medication. But she read it as 5. And she gave 10 tablets. She gave it. This patient is waiting for pre-op. But this girl, petrified, ran high and low, and I remember my ma'am walking inside, and then she said, please do something I gave wrong. It's in a small palade, we powder and give it. The mother was still there. And then, of course, the doctors were on rounds. They said, don't worry. They put a rice tube in and they took out everything. The student didn't go for lunch also, was waiting. And she was brought to our whole class, to various classes, and said, this is the quality the nurse should have. Because you are practicing field when you are a student or a nurse is human being. You have to be truthful in what you're doing. You'll be forced around by doctors, by others, by this, doing all sorts of things, saying that you didn't do, or don't give, or whatever, and say you give. But to me today, I would consider integrity as a vital quality a nurse should have.
Take one more question.
Ma'am, my name is Sudeep. I'm from Little Flower College of Nursing in Toronto. You have just said you had many hardships in your life. Can you share some of it? This has shaped you into something good.
The hardships that I can say is sometimes it's our own people, our own nursing itself. Why I'm saying this is, when I was working in hematology, I was coming with new ways of looking at things. And the nursing superintendent's office will not allow, because the policy doesn't allow nurses to take on certain things. You understand? I'll give you one example. Blood transfusion in hematology is like giving water. We had 250 blood transfusions in a day, and a doctor has to come and then he has to give. And by the time you bring the blood bank from the bank, it takes even longer, right? So I was trying to see whether we can do an accreditation for nurses to do blood transfusion. At that point, I'm talking about long years back, there was a lot of resistance, but I didn't give up. I showed all examples where blood was not given on time or it was getting spoiled and things like that. Finally, we got done. That's number one thing. Sometimes, the resistance comes because of the institutional policies or norms that is followed. but how to make them sensitized to that need and try to change that is number one thing that I would find. Secondly, you might find the problems that I have faced is teamwork. You know, teamwork. It can be the hierarchy that we have in our own system or other professionals. How to make sure that we look at, for example, let me take in our own country. We have a hierarchy in the health system. The doctor is like there and we are below, right? Sometimes they don't understand what we are saying. How to ensure that they understand? If you're knowledgeable and you are saying something that is really right, and if there are people logically thinking, don't give up just because you said once and they didn't listen. We have to go on and on and on and try to make them sensitized. Change a culture to show that you are saying something valuable for the healthcare of the patient. You will see that you can change. So these are some things that I have found. Sometimes it is difficult, but how to sensitize? One may listen, other may not listen, and you have certain ways by which you behave. But still, you don't give up, and if you are knowledgeable and if you are 100% sure what you're saying is right, you stand by it and keep on working through different people, you will get that done. So these are a couple of things that comes to my mind when you say, what are the difficulties that I have faced?
Thank you very much. I do understand you have lots of questions to ask Professor Dr. Selva Titus, and we can have the discussions after the lunch break. Now it's time for our second speaker to take the session, and I certainly say it's going to be a very informative session, and I welcome Dr. Lata Venkatesh to take the session. Thank you.
Namaste everyone. I am extremely delighted to be among the youngsters. Sometimes people ask how you are looking young. Because every day I interact with young students, with youngsters. You know, we should always have young friends so that we learn the technology. Do you agree? The students and my daughter, they know better how to prepare a PowerPoint presentation than me. I was preparing this PowerPoint presentation and my daughter was coming and looking at, Mommy, you are going to talk to the present generation. You have to change your style of speaking. You should speak what they want to listen. This you are talking it, like taking a class, you are putting the slides. You know everything. You have to speak what is going to be interesting to them. So I am extremely thankful to ASAP, especially Dr. Usha Titus, who is here, for giving me the opportunity to interact with the young minds. Yet another objective of this meeting I have in my mind is, we are growing old. Still, we have a lot of unfulfilled dreams. And this is an opportunity to transfer our vision, to transfer our dreams to all of you. If you are able to catch up some ideas from my talk, if you are going to work on it, or if I have triggered you, your critical thinking, or the way how you are going to progress, I think that will be the success of my talk. So thank you very much for the opportunity. Here you will see 4 beautiful girls. These 4 beautiful girls, my daughter was telling, Mommy, you are having Janani, the cine actress here. She is not Janani, she was my student. All 4 of them were my students and they were from Kerala. So, Kerala is the identity for nurses across the globe. If you ask chocolates, Belgian chocolates are good. You ask anyone who is the best nurse, they will say Kerala nurses. So it is so wonderful. And I was very fortunate that I was a teacher. When I was a student, I had a lot of Kerala friends. I learned to read, write and speak Malayalam. And I had 80% of my students as Keralites. So I'm very close to Kerala. So I'm again thankful to God Almighty for bringing me here and inspire all of you. Now these students are all, I don't know in which country they are, in what position they are, but I'm sure they will be excelling wherever they are, because we have instilled the right spirit in them that growth is inevitable. The child has to grow. Infant cannot be an infant. So today I am seeing all of you as infants maybe, but I tell you, every king was born as an infant. He was not suddenly born. So I am seeing all of you as the future nurse scientists, nursing directors, principals, deans. Maybe these are all older designations. You might come up with some wonderful designations. Entrepreneurs, I will see nurse-led clinics by you, taking the entire healthcare goals on your head and showcase how you're bringing down the SDGs or improving the SDGs at the global level with nurse-led initiatives. Is that possible? Do you believe? Yes? Yes? So, whatever you are doing, it is, you're building the country. You're building the healthcare indicators of the country. You might have initiated breastfeeding within 1 hour of birth. You have laid the foundation for the baby to be free from infections lifelong. Yes or no? This simple one. You may be thinking, oh, I have to initiate breastfeeding. Oh, they told, let me do it. But you know, you are building a nation. You are building a generation. You are building the indicators for the country. So if you have that kind of outlook, I think each and every action of yours will speak volumes. Today when the chief guest was talking, you might have been thinking, of course I have the faculty crowd also here, you might have thought, do we have such elements in our profession? We have. What we are not having. After listening to few of my slides, you can tell where do we lack and where we should patch up the gap. And the future is in your hands. Now, next slide please. See this one, every accomplishment starts with a decision to try. This is my psychological journey I wanted to share with you, because this is a world where you will face a lot of domination. You know, there will be a lot of inequalities. You may be suppressed, but never forget to try. I did not become a nurse by choice. I didn't know what even nursing. My mother wanted me to become a nurse. I went to buy the application for MBBS. Yesterday was the last day and they said time is over. That year only entrance examination was introduced. Then I joined BSc Zoology. There was no graduate nursing in the city in Coimbatore. I am from Coimbatore, the neighboring city. And only diploma in nursing was there. I didn't want to become a diploma nurse because I wanted to become a graduate. Then it was the plan of God, as Madam was sharing. Everything is the plan of God. Whatever is happening is not happening based on your decision or your parents' decision or somebody else's influence. It is the plan of God. Destiny is already written. You are already a finished product. If you are buying a cell phone, it has to do all the functions. So when we are born itself, we are finished products. Where are you going to reach is already destined. You will be led in that way if you believe in God Almighty. So what happened? Ramakrishna College of Nursing was started, first private nursing college in Tamil Nadu. In radio there was an announcement. I wanted to become a graduate nurse. This is BSc Nursing. I went and joined. I was the first student who joined. Why I am telling this is, whether you are studying in a smaller institution or a bigger institution doesn't make a difference. There is an advantage. Whether you are studying in a government institution or a private institution or a mission institution or corporate institution, it doesn't make a difference. Everywhere there are opportunities. You know, we were only 15 students. The best surgeon in the city taught me how to do suturing and how to prepare the patient and assist for the surgery. The best anesthetist in the city taught me intubation. The best gynecologist in the city, where even minister's wife used to come and deliver under her, she was holding my hands and taught me how to conduct delivery. This would have been not possible if I have entered a bigger institution. I would have been one drop in the ocean. Whereas I gained complete attention and I gained all the skills. So when I wanted to do MSc nursing, again I was hesitant to apply. India had only 5 colleges which was offering MSc nursing. If I get seat in RAK College of Nursing, you should know Hindi, then only you are eligible. So after completing BSc Nursing, I took private tuition, and with the children studying 2nd standard and 3rd standard, I went and wrote 4 Hindi exams and made myself up to 10th standard. So from where did this drive came? You have to have a dream. I have put here, imagine yourself having achieved. If you're, the last line in the slide is, you have to imagine yourself where have you achieved. Then you will start working towards that goal. Then CMC Vellore. My God, I was thinking they were telling, oh CMC Vellore, all my teachers were from CMC Vellore. So they were telling, oh, it's the seat there. You're a Hindu, you will not get it. So difficult. So I didn't have the courage even to buy the application. Why? Please do not put yourself down. I didn't want to try. I thought, my God, I studied here. Will I be able to compete? Oh, they are giants. Will I be equal to them? I got the seat. When I entered into MSc Nursing, the genetics are kept to the pre-test out of 25 MCQs. Then when he came with the paper, he said, who got the first mark? One of my classmates who is very smart stood. I got, sir. Oh, is it you? What was your mark? 23. Oh, 23 out of 25. There is someone who got 24 out of 25. Then slowly I got up. I didn't get up in the first instance because I thought somebody would have got 25 out of 25. Why to feel ashamed? So when I got 24 out of 25 in the pre-test, you should maintain that. No, you should not get less in post-test. So I was walking embryology genetics, I was eating embryology genetics, I was sleeping embryology genetics. I learned more than what a geneticist and embryologist will write in the paper, same feedback the doctors they gave me. And I applied whatever I learned. Theory, every care plan I enjoyed, applied the theory. I wrote the verbatim. Each one I enjoyed and I wrote. So that enjoyment, you should enjoy your learning, it should not be burden. You should enjoy. Then, I have so much to speak, but there is no time. So, goal does not depend on anyone to achieve. Don't think that, oh, only those people can achieve it. Oh, they are very brilliant. They studied here, they will get it. No, definitely no. The same thing is applicable even until today when I was working in Apollo Hospital, College of Nursing. For 17 years, I joined AIIMS only 2.5 years before. So when I joined the Apollo College of Nursing, before me 3 principals left. I was the 4th principal. Nobody survived more than 2 years. I survived for 17 years. And even today they are welcoming me. If you want, you can come back. You know, that is the credibility you have to gain. Then what happened? AIIMS, when I applied, I didn't even want to go for interview because I was very sure I will not get it. I was 100%, more than 100% sure I will not get it. So only one day before my husband said, you will not get it. Just simply go and come. Like going for a picnic, go and come. So last day I booked the ticket and I went. 192 applicants applied. And finally when the results were declared, I got selected. If I have not tried thinking, oh, AIIMS, New Delhi, you know, it's not so easy to get inside there. If I haven't applied, if I haven't appeared for the interview, how it is. Similarly, my MPhil experience also I will tell. Manipal started MPhil for the first time. That time I have completed MSc Nursing. I was working as an assistant professor in 1996. Then when I went and wrote MPhil exam, so many students sitting and writing, only 6 seats. Then next day the result was announced. I told I will not even go and see the results because I would have definitely not got it. Why did I come? Why did I pain myself to come and write entrance exam for MPhil? Who is forcing us to do MPhil? Like this I was thinking. And one of my family members who accompanied me, I stayed in Mangalore itself. They went to Manipal and they saw, or somebody else who wrote, they called me. Lata, you got the first rank. You got the first rank. So, see, this is how you may be thinking, oh, it is not for me. Oh, so many people are there before me. So many people are intelligent. Oh, they studied in a better institution than me. Oh, they have good language skills. I'm telling you, dear, keep trying. If you don't try, you will carry the guilt feeling. If you try, then only you will know where do you stand. So this is one message I want to tell you. Whether you want to go abroad, whether you want to be in India, whether you want to go for higher education, keep trying, never stop trying. If you stop trying, that day you're dead, you're professionally dead. You have to stop trying. So I am continuing to learn, my journey is continuing. I did MSc acupuncture out of passion. So that I completed in 2020, I think, then the results were delayed. Recently I have done mini MBA in rural healthcare from Arizona University. So keep on learning, there is no age for learning. This motivation I got from my nursing superintendent. When I went for MPhil, she was my classmate. She was 56, I was 26. People thought that she is my mother who has come to accompany me for because I am a dull student. I was so thin that time. So this was the motivation we had from our leaders. So we are sharing here so that we will remain as an inspiration for all of you. There is no age limit for learning. Next slide. And here, as I told you, the students are different now. You have to change your method of teaching. You can't be teaching in the same way how you are teaching. You have to keep on adapting. So, and COVID has taught us so much lessons that we have to do mass learning. Now you have opportunity for mass learning. Today I am only talking to people who are only 100 students, they said 110 students and few faculty members. But with the technology, you can talk to mass media, to multiple people, to crowds you can speak. So we must learn this, how to teach crowds. And then visual aids, we should know how to prepare the visual aids. And interactive instructions, relating lessons to real life, this is all important, feedback is important. So next slide I will tell you how I brought all these ideas in my mind into teaching. Next slide. So we asked 22nd March, the whole country was shut down, all borders were closed. 22nd March, I sent all the students to Kerala. COVID. But I cannot, you can close down the campus, you cannot close down learning, you cannot close down education, you cannot say that you can get your degree after 2 years. You have to teach what to do. 22nd we closed, 24th I started with Google Classroom. I didn't know what it is Google Classroom. I don't know how to do online teaching. I have not even done one single Zoom meeting at that point of time. Then I just called one IT student and he said you can use GCR, and he happened to be brother of one of our faculty. Immediately it was all free, we have set up. Within 48 hours we started our class. Then the registrar of Tamil Nadu Nursing Council called, Lata, now we are all shutting down, we don't know how long it will be shut down, what is your idea? I said, Madam, I have started with Google Classroom. She said, can you do it for the entire state? Yes, we will do it. That is when I learned how to teach the mass. Every day morning 6 o'clock for all the classes in Google Classroom, the topic will be delivered. Because in Apollo, I had the learning management system, all the slides were there. We had the bank. So entire state, we were giving daily, they were learning. Because of that, the teachers were getting the salary, the students got the degree, the classes were not shut down. But don't ask me how did you do clinical learning, still I didn't master that. Then, flipped classrooms. This made us to learn flipped classroom. The slides are already shared. So only have classroom in the classroom discussion. Students have to do pre-learning and come, read and come, that is flipped classroom. So it is promoting the critical thinking and interactive sessions or classes. Then tabletop exercises. You have to teach disaster management mock drills. How will you do it? Then Israel team taught us how to do tabletop exercises. So we purchased the small dolls and made the unit and taught tabletop exercises, how to do disaster management or how to attend codes. I think many of you must be from NABH accredited hospital. You have to do all the codes, code blue, code red, code orange, different type of sports. We taught with tabletop exercises. Then, still, you have to give care for the patients. You have to interact with the patients. What to do? Patients as educators, this technology I have used, I have published also. So we brought few patients like dialysis patients and the patients coming to OPD. We brought them to the classroom and made the students to interact with the patients. The students really liked it. The patients also liked it. So patients as educators, that was one of the technology, teaching technology we used. Then simulation and virtual reality. You know, virtual reality, in 2010 itself I have implemented. We used virtual reality for therapy. That is nothing but you purchase a sensor for 30,000 rupees and games are fitted in. And use the games to produce movement for the patients. I personally realized you have to do the game, you have to jump, go like this, like children are playing, no, like that. Then only I realized how many joints were not moved for years together. I could not lift my shoulder after certain extent. So when I have to do the game, I have to jump like this, I have to crawl like this, I have to go underneath something. Then only I realized how much we are not using our body movements. Then this can be used for arthritis, this can be used for vertigo, this can be used for treating anger in alcoholic clients. Everything, but I am standing here only, but virtual reality entire scenario is being developed. Then AI based learning. What is this artificial intelligence based learning? Artificial intelligence is nothing but if somebody is good at something, as I told you, I was taught how to suture by a famous surgeon. He said even a tailor cannot stitch like me. He used to challenge. So you capture what is making him to feel proud. What is the talent he is having? If he is suturing, how much depth he is using, which muscle he is using, where he is turning, how much time he is taking. You capture his trade secret and build that into steps and teach the students. So in AIMS this was done. No, AI based learning. They have kept the suturing material. Student is suturing and in the system it is coming. Oh, she is not applying adequate pressure. She is not turning here. She is doing like this. Time is extra. Feedback, instant feedback is coming from artificial intelligence. Now this artificial intelligence, you all will be very happy. There is a OpenAI which has come. What is OpenAI? Any postgraduate students are here? Any PG students are here? All are undergraduate students. Okay, undergraduate students. You want to write an article. You give the topic. There is a chat GPT now which is based on OpenAI. It will write and give you. It will give, but you must be able to give appropriate command. You know, one of my friend was telling that, asking, using this artificial intelligence, how it was done. One simple example I will tell you. He asked, what is 2 plus 3? 2 plus 3 is 5. Answer it has come. You will think that, okay, this answer will come even if you do your Google search. Then he said, no, my wife is telling it is 4. Then it is telling, I searched all my, what is that, the coding or something. It is only 5. To my knowledge it is 5. Then again my friend was telling, no, my wife is still arguing 2 plus 3 is 4 only, what to do? Then immediately the answer came. Okay, let me check. Then the answer came, please avoid arguing with your wife. Argument is not good. See, this is how they are fixing the answers. So you can test, you can ask for wrong answers. So this OpenAI is going to change the entire way of teaching, entire way of learning. Everything is going to change. So it is better to remain updated with how the AI is going to be applicable. Then algorithms. See, you will tell me, simulation is nice, flipped classroom is nice, AI is nice. What to do with the exams? We only have to write the exam. Google cannot write the exam. AI cannot write the exam. You have to write your exams. What to do? So, what I did was, I developed algorithms. All the subjects, every unit will be there in only one page. I was teaching research methodology. Research methodology is only in some 10 papers. You put algorithm, all the concept. So the student reads only this. So Apollo students were getting gold medal continuously. They were telling how they are getting. These are some of the techniques which we have used. I read the whole subject. I made the teachers to read the subject, abstract and give only the side heading in an algorithm. So under the algorithm, whatever you are writing, your imagination can be written there. But if the side headings are alright, if you know the side headings, you will be able to write. So these algorithms I have used. So these were some of the things I'll tell you. But I don't want to spoon feed you. You also use the algorithm. Please adopt innovative methods of teaching. The method you are using today will not be any more interesting the students tomorrow. So keep updating and keep identifying innovative methods of teaching. No need to copy someone. Next one. Newer methods of evaluation. Again we learned this OSPI and OSPI and clinical vignettes, giving clinical scenarios and evaluating them. Then proctored exams. You have to conduct online exams. How do you know they are not googling and writing? You know. So proctored exam. We hired some software people. Proctored exam. So your eye movement, how you are referring, all those will be captured. Of course, it was a bit expensive. So proctored exams happened. Now all your competitive exams are proctored exams. All of you have to write the competitive exam. You cannot escape now because for MBBS they are bringing next. That is at the end of the course they have to write an exam. Whichever college you have studied, you have to clear an exam to get yourself registered and get the license. In nursing also it is going to come. So you have to write an exam. It will be in your location. It will be a proctored exam. It will be given to TCS or Wipro or somebody. You have to write as a proctored exam. And I don't know how many of you want to come join AIMS. All of you are welcome. But you have to clear an exam called NORCET, Nursing Officers Recruitment Common Entrance Examination. I don't know how many of you know, you have to write that exam, NORCET. This exam is conducted in 240 centers across India. The project is given to TCS. So when you go there, your iris is captured. And when you go and sit there, again there is a camera. It matches your iris. In between you get up and you say that make somebody else to do it. Iris will not be matching. The system will close. You cannot write the exam. It is iris-based identification which is fit into the competitive examinations. So this is how you have to appear, whether you want to go to Gulf countries, you want to go to Singapore, or you want to go to UK, USA, everywhere you have to write this computer-based test. And it is all proctored exams. So that is good. Then rubrics. Rubrics is all the students' behaviors are being developed. Like Madam was telling competencies. The competencies are developed. We'll talk later because there is no time. Then interacting with AA patients. This is very, very important. If anybody want to take a project also you can take. We can create AA patients. You have to create avatar. I had an experience, somebody gave me free access. They said it was this was part of my, one of the degree I did. They gave me the opportunity. AA patient is there. A difficult employee is there. You want to bring in the change. The employee is opposing you. How are you going to counsel the employee? How are you going to counsel the faculty for changes? So the most difficult faculty was created as an avatar, and I have to do the counseling. I have to make her accept. Then whatever I am telling, it is telling, no, this change is not necessary now. I am already overloaded. Why this one? This is not the right time. Why you have called only me? You could have called everyone. Whatever I am telling is not only the opinion of me, it is the opinion of the entire group. Blah, 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 blah. My God, you have to manage. Convince her to accept the change. And my entire convincing skills was captured by artificial intelligence. And after that they gave me the feedback. You could have listened a little more time. You could have picked up this clue here. You could have used this strategy to convince her. You could have done this. Of course, they also praised, you know. It is good that you were so confident, you were able to take up the exercise. First, they praise. Everywhere you have to use this one, PIS. That is, you have to praise, then you have to give information and suggestion. This should should be the model of communication. If you are not using this PIS model, PIS model, people will not be engaging in communication. So they were praising me, okay, you are very good, and they said these are all the techniques available, and they suggested you could have used these are all the techniques. This is possible. So is it possible what Ella was speaking today, the chief guest, that you can have your own startup? You apply for startup and create avatars. Can you create AA patients? Can we create AA patients? You can create schizophrenic client. You can create diabetic. You can create an antenatal mother and make the students to interact with the patients and families. So these are all going to come up. If we are not doing, somebody else is doing, and they will come and sell the product to us, we pay them and we make them multimillionaires. Am I right or not? You were using only Chase doll. I learned or used only Chase doll, which was only 20,000 rupees. I started 14 colleges for Apollo. I purchased only for 20, now it may be 40,000 rupees. Now what is the cost of the dolls which is coming, the simulators which are coming? In lakhs. Who can afford for it? You think of having our own low cost simulation models. Develop upon this one. Here only you have to use the technology and develop AI, develop low cost models, develop the products. We are not venturing into those kind of activities. So that is one area to explore. Next one. Quality assurance. This is my passion. You know, if you see on the side, there is one I have put KPI. How many of you have heard this word KPI? KPI. Have you heard, faculty members? KPI. It is key performance indicators. I am telling you, quality assurance is there in any field you are stepping in. Whether you are going to be in education, whether you are going to be in clinical area, whether you are going to be in research, you are going to face this key performance indicators. What is that? Every behavior of you, every performance of you is observed and converted into numbers. Converted into numbers. They will say percentage of hand hygiene compliance before the procedure, after the procedure. Somebody is monitoring you. Whether you are compliant to So similarly, these key performance indicators, if you see, there are objectives and there is a measurement. All our behaviors are converted into numbers. It is analyzed in committees. They do root cause analysis and they find out the ways to optimize. So you will be undergoing this cycle of exercise wherever you are working. Whether you are working in India, I saw somebody was talking that Kerala students are studying in 54 countries. I don't know how, in almost all the countries they will be working. But they are going for studies itself to 54 countries. So any country you go, you will be under this framework. Your behavior is under observation, it is converted into numbers and they will give you target, you have to improve like this. Your hand hygiene compliance last month was 30%, you have to improve to 80%. Or it was 80%, please go up to 100%. If you are 100%, methods to sustain it. This is how you are going to work. And this is patient care. You have JCI and NABH accredited hospitals and nursing excellence standards. In 2010, myself and 11 like-minded people, we joined together and framed the nursing excellence standards for the country and gave it to NABH. There was a lot of opposition. Oh, whole hospital is going accreditation. Why only nursing has to go for accreditation? Why you are giving accreditation only to radiology department? You are giving accreditation only to blood bank. You are giving accreditation to emergency department. Nurses are present across the hospital. There is no department without nurses. Why can't you give? Then the CEO was very supportive to nursing. Then the nursing excellence standards have come. Today more than 200 hospitals are accredited with nursing excellence. Any hospital here which is accredited with nursing excellence? Yeah, which hospital? Yeah. Believers Hospital. See, then you talk to him, he will tell the journey, how it was helpful. I'll tell you, the moment you take up your accreditation, you will have a language to speak. You will have a way of expressing, I am good at this level. Whether you are below the benchmark or above the benchmark or you are on par with the benchmark, you will be able to tell others, you will be able to present, you will be able to demand, you will be able to sustain. So you will know this quality assurance is very important. And in education, NAC accreditation is there. NAC accreditation, any institution here NAC accredited? Yes. 8 criteria are there. You know, these are the motivation. Somebody third party comes and sees how you are performing. Otherwise, people say that, oh, I am very great. But somebody else has to say that you are very great. Not you yourself claim that you are very great. That is how the third party assessment is done by NABH and NAC. And you know, there is one word called NABET. This NABET word, Quality Council of India has got one more vertical called National Accreditation Board for Education and Training. As Madam was telling that they are developing the accreditation framework in Dubai. Here also we have, but currently they are only doing for schools. Now nursing is being taken as part of that organization, and assessment framework is being formed, and now training is going on. UP, they are going to do the pilot. All the colleges will undergo this assessment under the accreditation process, accreditation framework, and they are going to find out the deficiencies, and it will be rolled out for the entire country. So it is going to be very specific for nursing. Otherwise, you may say that when we have NAC, why NABET? NAC is for every institution. NAC also I wrote. This I will tell you. Wherever you are finding a gap, please communicate to the policy makers. Nurses do not communicate to the policy makers. That is one of the deficiency in our profession. When I saw this NAC accredited NAC manual, it is for arts colleges, engineering colleges. Same thing is used for MBBS, dental and nursing colleges. I wrote to them, we are totally different. Then a committee was formed. They framed HSI manual, Health Services Institution manual. So the first draft, I was part of the committee. We framed the standards separately, Health Services manual, so that your standards are different, because we are not equivalent to arts college and engineering college or another some other stream of educational discipline. So that was saying, this is gap. When you find a gap, write to policy makers. If you are not writing to policy makers, nobody will know, and you say that, oh, nursing in velaye illa, nursing in onnu illa, ella budget ellam avaru kondu pogum. This is how medical college also, they say, oh, all the budget they take. Did you ask any time? Now in aims for nursing research, I told we need some separate fund. You have to submit the research project along with everybody. Then 1 or 2 projects get selected. I told you, give me separate funding. They have around 20 crores for research funding, only 5 crores are utilized. Then when I presented, they liked it. They said, okay, we will give you yearly 10 projects, 10 lakhs. So you make your faculty. I have only 36 faculty. They said 10 of them, let them do. Each project will go for 2 years. Next year another 10. So they immediately allotted 50 lakhs per year. 50 lakhs per year, and every year 10 projects, which is worth 1 crore is sanctioned. 2 years it will continue. So if you ask, immediately a committee was formed. They have given. So now there is a PISA. You know the pie chart, PISA. Totally health budget is given. What is your portion? Which bit you are going to get? Sometimes you may not get any bit. Everybody will go and follow it. They'll eat the pizza and go. Finish the pizza and go. You will not get your share of the pie until unless you ask, until unless you have vision, until unless you have plans. Now this ASAP is a very good medium. You ask the proportionate allocation of funds, and getting allotted the funds is not very important. You have to utilize. Government has got 3,000 crores budget for nursing, Ministry of Health and Family Welfare. How much it is utilized? When it is given to the states, they are not utilizing and returning it. And they say we are returning with this much interest. Are you a banker? You are given a money to make the interest and multiple and give it. It is used to develop your profession. It has to be used for acquiring the talent. So this is how you have to do it. Then research ethics committee accreditation. It is mandatory whether it is academic or not. I was the first one, maybe I don't know, but somebody would have done before me also. But I wrote to CDSE board under DGHS. And first independent nursing ethics committee in Apollo College of Nursing, I think. Otherwise we were dependent on the hospital. They will keep, oh, tomorrow is the ethics committee meeting. My PhD student is from Nagargoil. He has to rush and come. So I thought, why to be dependent on someone? Why you want a hospital ethics committee to accredit you? Give permission for your research. We framed our own ethics committee, which is accredited by CDSCO. Every 3 years you have to renew. Now so many other colleges are doing it. Now MGR University we told. So MGR University is now asking you have to give the certificate of registration with CDSCO. So all the colleges are motivated. So communicate to the policymakers. If you are not communicating, if you do something, you say, oh, only I am great, I do only for this thing. No, you have to share your knowledge and everybody should be benefited. A leader must be able to take everybody along with you, not walking alone. Not saying that, oh, I am bigger, you are smaller. God has created us symmetrically, no? Two eyes are there. If one eye is big, one eye is small, how will you look? If one hand is long, if one hand is small, how will you look? So everybody has to go parallelly. This world is for everybody to live, not only for few selected institutions or not for only few selected peoples. Everybody has a right to live on this earth. The air is the same. Prime Minister is also breathing the same air. We are also breathing the same air. There is no difference in nature. Is there any difference in nature? Nature is different from some certain category of people? No. So equality. Expand and extend whatever you have learned to others. So that attitude should come. Then CTRI registration. Whatever studies you are doing, you have to register at the Clinical Trial Registry of India. Don't think it is for drug trials. Even academic investigations, even if it is a psychological data collection, which is based on a psychological intervention, you have to register under CTRI. These are all some of the mandatory frameworks you have to follow for research. Next. Then research. I was doing only academic research. I have guided, very proud to say that, I guided 250 MSc students. I guided 18 PhD students. All these are there in the biodata, okay. But academic research, until unless it is utilized for the patients, what is the use? So it should be outcome-based research. I'll tell you, when I studied in CMC Vellore, my masters, there only I gained the motivation, cost effectiveness of newborn care after cesarean section. So after cesarean, the babies were kept inside the nursery for 48 hours. And then they will be shifted, then breastfeeding was given. By the time baby learns artificial feeding, it will not attach to the breast, then bottle feeding becomes their food. So in my study, we transferred to the mother side. It was a cost effective study. So they gave that kind of support, encouragement. The faculty were doing the dual responsibility. My professor was the departmental nursing officer. So she had all the authority and tell the doctors, this is what my postgraduate student is going to do. She was in a position to say that this is what we are going to do and get the complete support from the medical team. That way we have to develop. For that, integration has to come. I'll tell there are multiple methods of integration. So what happened, I transferred the newborn to the mother side. This was in 1994. And the babies were able to suck at the breast. Lot of cost was saved. Otherwise we had one nursery, K nursery, 40 babies. Only all well babies will be there. Every 2 hours feed it, and after you feed, change the nappy. This was the nurses they were doing, which the family member can do, the bystander can do. So we have saved the manpower, we have saved the cost. And today, after my research study, that has been implemented. The babies are transferred to the mother side. Am I right, madam? Yeah. And Dr. K.R. John, whoever my guides, they tell this in every conferences. So here, outcome-based research is done. Then you will say that, oh, you are telling still what you have done in 95 as a student. What is the fun there, you may be thinking. I'll tell you the recent one. Medical emergency warning signs is there. Medical emergency warning signs is when the patient's condition is deteriorating, you make your vital signs chart as a tricolored chart with the green color, yellow color and red color. Automatically when the values are abnormal, it will fall in red zone, it will trigger and the nurse will inform the medical team and you can prevent cardiac arrest if you implement medical emergency warning signs. Of course for adults it is separate, neonate it is separate, the pediatrics parameters are separate. You cannot use the same parameters. So we brought down the number of cardiac arrests. You have numbers. This is an example for outcome-based research. Like madam was telling how with the dressing they were able to bring down the infection rate. So that has been captured now by all the hospitals. Part of the NABH accreditation, surgical site infection, central line infection, catheter associated infection, and VAP, ventilator associated pneumonia. These 4 are being captured. Of course, there are so many infections we can bring down, which will also come in future. So you will be able to say, do outcome-based research. You can also develop a product. Once one student came, I'll tell you one example. I went for assessment to a hospital. The nursing superintendent said, you know, the current age students do not know anything. Nothing, no teaching is taking place in the colleges. They don't know anything. You know that Nelson's inhaler? Nelson's inhaler. That is still useful, okay. So, they were telling you are not supposed to pour the water above the teat level. If you pour above the teat level when the patient is, inhaling, they will inhale the hot water and it will cause the burns of the respiratory tract. So, this girl poured above the teat level and a patient who got admitted for hysterectomy sustained the burns of the respiratory system and went on ventilator. And they terminated the nurse. I told you have not terminated the problem. How many nurses you will terminate? Everybody who is doing mistake you will terminate. If you are a leader, you must have the preventive action. Am I right or not? How many of you agree? Many are sleeping here. Okay, I'm sure this is going into your mind. Okay. So preventive action is essential or not? So when I said this, you were thinking, my God, I also may commit some error. I may be thrown out of the job. Did any of you get that kind of fear? Yes or no? Are you afraid? You are afraid, no? But if there is a good leader, they should have preventive action. So you should build in a mechanism, even if a nurse wants to pour the water above the teat level, there should not be a chance to pour the water. We have not redesigned the product for these many years. Do you agree? The faculty members, do you agree? The same Nelson's inhaler which I used in 1986, the same thing we are using now. The product is not modified. Who is responsible for it? It is you who is using the product. It is not somebody else. Why we have not collaborated with the engineering department and redesigned our products? We have not done. Once an engineering guy came, he came with a small clip. Ma'am, this clip, it was looking like a paper clip, you know, the broader paper clip. He said, I have designed this has got a sensor. And if you fix it to the IV tubing, it will give an alarm when the IV fluid is about to be over. It is a very small product, which is part of my PhD, this one, engineering guy. Madam, will it be very acceptable? I said, this is a wonderful product. Why wonderful product? How many of you have seen blood going into the IV line, IV tubing? I have seen even going up to the bottles when we had glass bottles, if you don't put a needle, it will suck because of the vacuum. So patients are inside the room. So you fix this. When now even all antibiotics, it is now mixed, diluted in 100 ml saline and given. No injection is given directly. High risk medications, antibiotics are diluted and given. Will you stand there only for the 100 ml to be over? You have given 5 or 6 patients assigned. You fix this, it will give an alarm. Wonderful product. This is product, this one. I also have done some products, no time so. Then clinical pathways. What is this clinical pathways? You must be able to give the roadmap when the patient is entering into the hospital. This many days only you are going to stay and I am going to do this on day 1, day 2, day 3. Do you have such map with you? The patient asks, how many days I will be here? What is going to happen to me? Do you have answer? The patient comes for total knee replacement. Have you predicted the length of stay? How many days the patient is going to be in the hospital? What are you going to do on the day of admission? What are you going to do at the time of discharge? Both are different, no? Yes or no? In between also care is different. Have you listed down what are you going to do? So you will say, oh, we have nursing care plan, we have nursing diagnosis, very lengthy nursing diagnosis. Nothing is standardized. You go to hospital, they will write anxiety, knowledge deficit, all these only because NABH accreditation, assessors are coming, nursing care plan is mandatory. There is no relevance, there is no connection, there is no application of the nursing care plan written by the nurses and the actual patients. You are doing that exercise just to eyewash the assessors. You have to standardize your care plans. You should have the template of care plans. You must use that as an educational tool. They must only use the time to choose, not sitting and writing, putting line, plan of action, what is that rationale, this columns, no? evaluation. Is it really useful for the patient? Patient comes with pain, he wants immediately pain relief, he don't want your care plan writing in between. Am I right or not? I am not discouraging care plan. There should be templates, there should be standardized, this one mentally it should be there. I worked in Kuwait Army Hospital. MI patient admits, automatically care plan gets generated. I choose the actions which are applicable to my patient, I customize it and I document it. There it is possible. Here you sit and write, continue to write, okay? Then mobile apps, AI-based apps, these are all independent practice also. You can develop apps, you can guide the people. I will tell you lactation, two months before, we organized a breastfeeding counselors program. It was multidisciplinary. I had some physiotherapists, I had some dietitians, I had nurses, I had doctors attending it. You know, they are all charging for lactation consultation. They will go and tell the mother, you breastfeed like this, for each visit 1,000 rupees is charged. Lactation consultants are earning in lakhs of rupees, they are not nurses. Can't you become lactation consultant? Can't you go to multiple hospitals and do only promotion of breastfeeding? Our nurses will not do. They said, you take ECG, ECG nurse. They said, no. My God, I want to go abroad. If I take only ECG, what will happen? Today ECG technician has taken away your job. Now you phone ECG technician for ECG. It was your role, it was your duty. We have lost majority of our traditional functions to other disciplines. Because you have not projected, you have not given the numbers. You have not means you are all students, okay? I am asking me only. It is also me also. When I say 1, 4 fingers are towards us. We have not done that. We have not done that. This is how the profession, I am telling you, lot of opportunities which are not explored. Until unless you are an employee, you get a job, nursing will not develop. The day you don't get job, that will take at least another 30 years, okay? Then only you will think how to use your potentials and reach out to the patients and population independently on your own. As long as you get a comfortable job, you get monthly salary, it is very difficult to come out of the framework. So develop mobile apps, AI-based apps, and reach out to the population. It is so easy now with the technology. Next one. Next slide. Scope of practice, I have put only one, this one, local to global, global to local. Of course, you can become a clinical nurse specialist. I told already lactation consultant exam. I have created transplant nurse specialist. I created one, doctors wanted 4 more like that, tele-nursing. You can do, Apollo has started so many tele-nursing centers in Himachal Pradesh. For the whole state they have developed. Only one nurse is there in the remote Himalayan areas. She is connected through telemedicine. So she is able to chart out the appointments with all the doctors. She is able to assess the patient, give the feedback, she is able to give the medication and implement the doctor's orders. So doctors are only online. I am telling you, nursing cannot be separated from nurses. You can separate medicine from pharmacists. You can separate medicine from doctors, but nursing cannot be separated from nurses. Even robotic surgery has come. Doctors are operating on robo, but it is the nurse who stands there, coordinates both the patient, anesthetist and the robo doctor. Her role only has expanded with technology, has not minimized. So there you have to understand, nursing cannot be removed from a nurse, because we touch, we give care, we comfort. Nursing is a comforting profession. It may be a physical comfort, it may be psychological comfort, it may be a social comfort. That comfort, it has to come from a human being. That is where nursing, this is the strength of nursing. But we have to make use of it, make everybody speak that. So, local to global, global to local. What is that? Now all of you are here. Why did you join nursing? First you will say, oh, I want to serve the poor, I want to serve the sick, all these. When I ask you on the final day when you are going, now what is your, ma'am, I want to go to Canada, I want to go to Australia, which country is good, which is very easy to go, which is quick to process, which has English exam, which type of English exam is good. What happened to your caring for patient? First day objective. First day objective is not. No? But I am telling you, From local, you go to global. There also you will be giving patient care. Only the setting is different. Little money extra you will get. But I think you after few years you will find a back home. I worked at Kuwait Army Hospital. I did not work for more than 2 years. I felt there is no growth there. If I would have continued there, I would have remained only as a staff nurse. Maybe my salary would have become in lakhs. But when I came down to India, at the age of 34, I became principal. And I am principal for the past 20 years. Now you can guess my age also. Okay? Right. So, this is how I am telling wherever you go, patient care is important. So, I am telling you, go there for making money. Don't dedicate your entire life there. Come back and develop your own country. That is what Krishna Yella has done today. That is what Pratap C. Reddy has done in Apollo. He retired at the age of 50 and started a hospital. They said, you will not even earn 100 rupees. Now he has created hospitals, 74 hospitals across the globe, and he has, of course, nothing belongs to him still. Even now he has only one house for him. That is a 20,000 crore healthcare industry. He is called father of corporate hospitals in India. He came back. I'm telling you, don't go and dedicate yourself for whole of your life in other country. Come back and build your own local community. So local to global, bring your global skills to local so that the cycle is complete. Life is a circle, you know. Life is a circle. Globe is also a circle. Otherwise you will find a vacuum. Otherwise you will find a vacuum. You will feel that you are blocked. So come back and your local community. That is my this one. Then all these, there are nurse entrepreneurs you can build them. Nothing, nobody knows anything, they are starting crash. And they say only 1.5, 18 months child we can take. If I start a crash, I can even take care of a preterm newborn. Is that right or not? Yes or no? You can take care from day one. Why are we not starting the crash? Why are we not starting the crash? You leave your children in the crash and come. Yes or no? Dialysis units are run by nurses. De-addiction centers are run by nurses. Is it possible or not? Only visiting psychiatrist, visiting nephrologist is enough. Think and start up, apply bank loan. You will get the loan. See, Krishna Yella sold his house and started the vaccine company. For all this, you need not sell your house. You sell only your knowledge and willingness. You will have your own startup. You will have your own profession. You can have your own palliative center. That is my retirement plan, okay? Palliative center. That's what I thought. Somebody climbed the hill with great difficulty. And after climbing the hill, there also they saw the plains. Nothing is there on the hill. So it is the patient care which will make you to excel in your profession. Finish. Yeah. Next. So you can have independent practice, all this next one. Next slide. So when you are choosing workplace, you use this template. Next one. Happiness is very important. Then next. Publications. If you don't publish, you will perish. We use only theories of Warren, theories of this one, that one, no Indian theories, because we have not documented our observation. You are not willing to give for others. You want to only develop yourself. Then how theories will come? Publish. Publications. No, whatever I am telling you is for me also. Okay, I am also part of the crime which has happened. Then impact factor, you have to see the impact factor citation, this one. And learning is boom to two, so you have to go for higher education, never stop learning. And continuing nursing education is mandatory for retaining your license now. You can have online courses, competency acquisition or skill acquisition is there, and you can also parallel. What is this paralleling? This is the advantage which the National Education Policy has given. National Education Policy says when we were students, we can do only 1 degree at a time. Now they say that you can do 1 more degree. You can parallel. This I was doing in Apollo. We had a tie-up with the Tamil Nadu Physical Education and Sports University, and they were doing certificate courses. They cannot do diploma and degree, certificate courses. So at the end of 4 years, they have so many certificates. Certificate in yoga, certificate in this one, that one. Even some people learned the Silambam, karate, wellness coach. They all had minimum 4 certificate courses at the end. So when their biodata goes, when your biodata goes, how will you compete? You need to have competitive advantage. So please go for paralleling courses. You can do simultaneously a distance education course even if you are an undergraduate student. Next, that is the advantage NEP has given. Next one, you have to network with the professional associations. Then only the visibility will be there. Otherwise, you will not be known and you will learn from others also. So please be part of an association network and contribute to the association. And social media. Every small observation you put in your YouTube. I just simply jokingly I started YouTube. Simply mummifying the baby, how to check the temperature, how to check the temperature. So many people have seen. I put one video, how to check pregnancy using the card test, putting few drops of urine. 27 lakhs people have viewed. This is reaching out. You can reach out to the mass, I was telling. Use the social media. Have your Instagram page, Facebook page, YouTube, and whatever small observation, please document it in the electronic media if you are lazy to put it in print media. So that will give you popularity and visibility. Next slide. Now, can you identify who is in this picture? Who is in this picture? Everybody will say APJ Abdul Kalam. But I am not going to talk about APJ Abdul Kalam. I am talking about the person who is sitting in the wheelchair and showing something, telling about his vision. That is Major HPS Aluwalia. I met him. I went to his hospital. You know, he was a major, he was a mountaineer, and he was a major in the army. And the Indian expedition, the first Indian expedition when they reached Himalayas in 1965, he was in that team. So he said, life is all about reaching the summit. Today your program is Professional Summit, isn't it? What is it? Professional Student Summit. So we are guiding you to reach the summit, to reach the Everest. Journey is not so easy. There will be unexpected turnings, unexpected climatic situations, unexpected people, unexpected things, but you have to reach the summit. He reached the summit and kept the Indian flag in 1965. You may be thinking I am talking about the summit, but nature was very cruel. The same year in the Indo-Pakistan war, he was shot by a bullet and he became paralyzed. All 4 limbs are paralyzed, paraplegia. He is on wheelchair. And you will see that stamp was released in 1965 when they reached the Everest. Next slide. So he said he thought life is all about reaching the summit. But beyond the summit there is something is there. Beyond the summit something is there. He has written a book that is Higher Than Everest. Higher Than Everest is when the bullet has paralyzed him, when he was bound to wheelchair. His mind, the bullet did not put down his aspiration, put down his energy, put down his adventurous nature of mountaineering and reaching the summit. He managed to convince the government and get the land in Vasant Kunj in New Delhi. Today it is heart of the city, those days it was away from the city. And he developed a 1,000-bedded hospital which is called as Indian Spinal Injuries Center. Today, thousands of patients got rehabilitated who are paralyzed, who are suffering from stroke. So that one bullet paralyzed him, but gave birth beyond the summit what he has reached. So that is the patient care. So I am telling you, any odd situation, whether you are rich or poor, whether you are black or fair, whether you are from remote area or urban area, whether your parents are abroad or here, whether you are married or unmarried, whether you have a supportive family or not a family, but this motivation should be there. You should go beyond the summit. But in nursing, what is beyond the summit? I am PhD holder, MBA, this thing, that thing. Reach the summit. Am I happy? No. I told you after reaching the summit you will realize again you have landed on the plains. Again you have landed on the plains. So what is there in the plain in nursing? It is the patient care. So never forget your patient care skills and utilize your patient care skills. I will put caring for patients is higher than the Everest. It is higher than the summit. Next slide. So this is what. When you start doing this, you will get credibility. The other day I was called by UP government and the principal secretary wanted to meet me. It was for faculty recruitment. I told I am on leave, I am not coming, I declined. Then they said, See, we are calling you not because you are principal of College of Nursing AIMS. We heard about Lata Venkatesan, I want to meet Lata Venkatesan. This is the credibility you have to gain. Yesterday I was part of Apollo, today I am part of AIMS, tomorrow I don't know part of what it is. You have to gain your own credibility. You may be Me Too, Baiju, Laiju, I don't know what are your names, but people should know you by name. People should start depending on you for your credibility, not because you are working in this institution, not because you are holding this post. No. You have to gain your own credibility, your individuality. You must be able to influence people. Then that is the leadership. Then leadership means don't think that, oh, I can come in Ben's car, I can come like this. The moment you become a leader, you must be willing to serve. You know, in Bible, Jesus has washed the feet of the disciples. So you must be willing to wash the feet of the people who are committed to your care. Then only you are a leader. Then only you are a leader. That is what Gandhiji also has said. Servant leadership. Willing to serve. So this is one essential quality you should develop. Willing to serve others. Next slide. Yeah. So this is the ultimatum. This I have put the satisfaction. Satisfaction is what is normally expected. For example, you are flying in a Indigo flight. You want to fly from Kochi to Delhi. It has to drop you. That is a must-be factor. That is, as a nurse, what will you do? Oh, I got a job, I am earning this one. Oh, I went abroad, I built a house. These are all must-be factors or normal factors. Or little more extra you have done. Maybe you have built 2 more houses. But what is this delightful factor? Delighting is you have done something extraordinary. So you have to make your patients delight. You must make your students delight. Everybody you should delight. You know. So when you are going and checking the temperature, if you are seeing a child, give one chocolate. Delight the child. Is there an opportunity to delight? Yes. You see a pregnant woman who has done love marriage, no parents. You just do this balaka, you know, we have done all these helpless people. Little bit. But I am not telling don't do this, I don't want to spoon feed you. You have to fit in, apart from your regular care, some delighting factor. That delighting factor will make you to be recognized as an individual who is an influencer. Thank you very much. Thank you very much. I don't know whether I have taken maybe 10 minutes, I can take an extra. But if I have influenced, if I have given some vision for you to grow, I think you will apologize me for it. Thank you very much.
Thank you very much, ma'am. We will have a question, one question. Is anybody want to ask a question? Yes.
Good afternoon, ma'am. My name is Merin and I'm from Little Flower College of Nursing, Andhra. So my question, so first and foremost, I'm going to tell you something and then I'm going to ask you a question. So we live in a society that is infiltrated with greed as well as material-driven success, and this particular fact is getting seeped into our profession too. So our professional education is often viewed just as the foremost strategy to gain success and nothing much. You see, nursing is a very, very difficult profession. We are just taking both clinics as well as education hand in hand, and this is a very difficult thing. And the best brains are taking up this profession too. But you know, this best brains itself, they take this profession just as a means to gain success. I mean, even if they are interested in studying more, even if they are interested in making a change in society, they are always getting inhibited by certain things. And they are not ready to cut off these inhibitions, mainly because they say it is because of the professional ego from their seniors, or because of what should I say, professional ego. Then also because of all those.
So many factors.
Yeah, there are so many factors. There are so many factors. So I want to make a change. I want to make a change about this. So if I want to make a change, I have to convince the people, the little cage that I am. So what can I do to make a change? to make a change within the best brains and to make a change in converting the best knowledge into practicability.
Very good question. You know, for everybody they will think that, oh, suppose if I want to drive the car, oh, there will be so many turns, there will be so many bends, somebody may come from left side, somebody may come from right side. That is what Ella also was telling, that you have a lot of fears within you, isn't it? So you said you have to convince a lot of people if you want to do something. Whom you want to convince? Okay, X, Y, Z you want to convince. Think if you don't convince, you do on your own, what is going to happen? Why you want to go and convince? Why do you want to get convinced? You start doing, they will come to you asking how you have done it. Share your success story. So these are all the mental blocks we have. These are all the mental blocks we will be having. So don't have the mental blocks. Oh, this person may not like. Are you living for that person? God has created you like that person. There are 100 people sitting here. Can you tell one of you who are similar to each other? You are all individuals born with innate talents. It is not necessary for me to convince her if I want to do something. You do it. Who is going to stop you? I said I want to develop low-cost simulators. Who is going to stop it? You think Lairdal will come and file a case? How can you develop low-cost simulators? No. They will tell, we will also support you. Can we partner with you? But you should have the talent to develop. You should have the talent to collaborate. You should have the idea. You should have the vision. You should have the determination. You must reach the summit. That is why this professional summit. You have the determination to reach the Everest and put your flag. Journey is difficult only, but your vision, that's what I put in my first slide. You imagine yourself you have achieved. My mother was telling when I went for this MSc nursing admission to CMC Vellore, the dean came and got out from the car, went inside. I told my mother, it seems one day I have to become like her. I am not remembering. But I became the principal ultimately, one of the youngest principal in Tamil Nadu at the age of 34. How it is possible? If I ask somebody at the age of 34 I want to become principal, they will say, hey, sit down. Only those who are retired from FMC and CMC can become principal. You cannot become principal, they will say. I became the principal. Now every college is having young principals. They are not waiting for somebody to retire and come and take up the position. You change the trend. When I joined the Apollo, I increased the salary. The senior most principal in the city called. How can you increase the salary? You're so young, you know what is budget. How can you give? You have given, now I also have to give. Ma'am, I am giving 30% of EBITDA to my company. They want only that much. Rest I have the liberty to give it to my faculty. I have done it. If you want, I can come and sit across the table and teach you how to pay your faculty. This is the same answer I think. If I thought, oh, she is so retired, dean from some big this is, she is giving only 10,000. How can I give 20,000? She never asked you to not to give 20,000. I gave 20,000. She part with me how you gave. I told I'll teach you how to give. This is how you have to progress. Don't have imaginary blocks in your mind. The world is open. You have to step out. You have to start something. You have to start doing something. All of you join together. You have to give ideas. Give ideas, and you have such a supportive government who is hosting this professional summit, brought people like us and facilitating. I'll tell you, you have to look at the positive aspects. Ignore the negative aspects. Negative thinking is to pull you down. Look at the positive aspects. Okay? Only 20% negativity will be there anywhere. 80-20 principle. This is known as Pareto principle. 20% negativity will kill your 80% of creativity. So focus on your 80% creativity. Rest of the 20 will turn into creativity.
Thank you very much. Now it's the lunch time. So we have arranged lunch nearby. So our volunteer and Sangeeta is around. She will take you to the place where you will have to have your lunch. After which you can go to the place where you have kept your bag and come back here by 2:05. 20 minutes time. Okay? Please go, have your lunch and come back by 2:05. We have 45 minutes of discussion and we can ask n number of questions to our experts. And please do come on time. I expect all of you to keep the time. 2:05. All of you should be here by 2:05. Thank you. എക്സ്പേർട്സ് ആണ് ലീഡ് ചെയ്യുന്നത്. മോർണിംഗ് സെഷനിൽ ചോദിക്കാൻ പറ്റാണ്ട് പോയി ചോദ്യങ്ങളെന്നൊക്കെ നിങ്ങൾക്ക് ഉള്ളതൊക്കെ നിങ്ങൾക്ക് ഈ സെഷനിൽ ചോദിക്കാൻ പറ്റും. അതിൻ്റെ ഒപ്പം തന്നെ നിങ്ങൾക്ക് സജഷൻസ്, ഓരോരോ ടീമും മിനിമം 3 സജഷൻസ് ടു ദ ഗവൺമെൻറ് കൊടുക്കുന്ന രീതിയിൽ സജഷൻസ് നമ്മൾ ഇവിടുന്ന് കളക്ട് ചെയ്തതായിരിക്കും. ഇവിടുന്ന് തന്നെ ഒരു കാൻഡിഡേറ്റ്, ഇവിടെ ഇരിക്കുന്ന ഈ ഗ്രൂപ്പ്, ഓരോരോ ഗ്രൂപ്പിൽ നിന്നും ഒരു സ്റ്റുഡൻറ്റ് വിൽ ടേക്ക് ഇൻ ദ ഡോക്യുമെൻറ്റേഷൻ, ഒരു പേപ്പർ നമ്മൾ സർക്കുലേറ്റ് ചെയ്യും. ഇവിടെ ഡിസ്കസ് ചെയ്ത എല്ലാ പോയിന്റ്സും ജോട്ട് ഡൗൺ ചെയ്തിട്ട് പോയിന്റ്സ് ആയിട്ട് ജോട്ട് ഡൗൺ ചെയ്യണം. രണ്ടാമത്തത് നമുക്ക് തന്നിരിക്കുന്ന സജഷൻസ് ഓർ റെക്കമെൻഡേഷൻസ് സെപ്പറേറ്റ് ആയിട്ട് ഒരു കാൻഡിഡേറ്റ് റെക്കമെൻഡേഷൻസ് മാത്രം ജോട്ട് ഡൗൺ ചെയ്യണം. ആൻഡ് ഇതിനെ ഹെൽപ്പ് ചെയ്യാനായിട്ട് നിങ്ങളുടെ ഫാക്കൽറ്റി ഇവിടെ ഉണ്ടാവും, സ്പീക്കേഴ്സ് ആയിട്ട് വന്നിരിക്കുന്ന എക്സ്പേർട്സ് നിങ്ങളുടെ കൂടെ ഉണ്ടാവും. ഓക്കെ, വി ഷുഡ് കംപ്ലീറ്റ് ദ ഫുൾ ടാസ്ക് ബൈ 2:50. ഓക്കെ, താങ്ക് യു.
രണ്ട് മൈക്കിനെ കൊണ്ട് ലാപ്പൊന്നും
കോഡ്ലെസ് ഒന്നും വേണം, അപ്പുറത്തേക്ക് കൊണ്ടുവരാം. Hello, can you come closer? Faculty, please join the groups.
മാം ഒരു സെക്കൻഡ് ക്ലിയർ അല്ല മൈക്കിൽ.
You know about this knowledge economy? Yes? You can take yes or no. Because you learn speaking. There is nothing wrong, you can speak anything. So first one is communication is very important. You learn to communicate. You may be young, don't have any inhibitions. Please come closer. Please come closer. Please come closer. You're all faculty members. Please come closer. You have to motivate the students. Please come closer. So, please. This is for each one of you have to from what I think or what you can forward. Okay. And then we'll also make the department in so anybody Kerala knowledge mission. I always believe there is a question is a always a question is a question. So welcome to ask anything.
ഇത് മതിയോ? ഇങ്ങനെ മതിയോ? ഇങ്ങനെ മതിയോ? അത് കിട്ടും. ഇവരുടെ പിന്നെ കിട്ടും, അവരുടെ കിട്ടത്തില്ല.
Physical and the education side. So then they have to have the dual responsibilities. So we then that's one suggestion we can give. And But in doing so, make sure that you don't jeopardize. Telenursing is a very good one. And this telenursing, you have wider application. Choose one area. When you are in fourth year you select OBG. So you will be able to give antenatal guidance, breastfeeding clinic, postnatal care. Daily, weekly 3 days or daily 1 hour. Your 100 students are there. You can make rotation who will sit there. And when you have doubt, you will have the consultants who will clarify your doubts. So you have to have training of the students to run the telenursing clinic, and you should have the supporting module. What are all the questions the patients may ask and what answer you should give and when will you refer. And you can prepare some videos to educate them, and you can have through mobile you can get connected with them. That is a very good telenursing, nurse-led telenursing clinic or telenursing clinic. Very good, excellent. And you can have it in your own place. In your own colleges have a telenursing unit, and you want to publicize so that you will be able to answer. So faculty also can be involved. So faculty also can practice that. Yes. And you identify focus areas, which are whether you are going to teach the diabetic patients about the diabetes non-communicable disease, or are you going to follow the other patients, tuberculosis, like that you can do. I did one school health initiative like that. We adopted the schools and set up a school health clinic with a telemedicine support. So every school, one nurse will be there. She will do all screening, educating the parents, everyone, and then she is connected through telemedicine to the main hospital. So any problem, any emergency, the doctor will get back. This doctor goes weekly 1 day, and the children like the school health nurse so much, and she is able to bring changes. And they have the numbers, how they have monitored the growth, how they have made sure the immunization, how they made sure hand hygiene practice, cough hygiene practice, menstrual hygiene. So you can show the metrics how you have laid the health foundation for school children. That also is one business. You can run school health clinics, and you can adopt one school and set up one center, and you all can be posted in rotation. See, if students will, 200 students will be there, even if 50 is there, 200 students, 365 days are there, Sunday schools are not there. So you can set up a small clinic and you can go there on a regular basis and take up the ownership. Only thing is, you have to show the difference. Before you set up the clinic, what were all the parameters? After you have set up the clinic, how you have improved. And you must make the parents and children to speak that how this was done. So you have to develop a project proposal. So you can have school health clinics, nurse-led school health clinics or school health centers, and tele-center. Tele-center in your own college, computer lab is there. A computer lab is mandatory by Indian Nursing Council. Those computers you will fix it. Only little extra is government will support. They will give you all the equipment, the gadgets required for running a telenursing. So we can bring lot of changes. Kerala is a tiny area, remote area. They have to travel so much of distance. So on a call you will be available. So that is a very good one. Yes. So one is the integration. Integration means please be very careful, otherwise teachers will be burdened. Already in government sector and all, we have only 50% of the faculty. With that you give 200, already they have 200% workload, and give clinical also, it's not going to work. So you have to think the other way. Have the clinical nurses involved in teaching. Let them come and take the classes. That way also you can do it. And for you, direct patient care, in 1 year you can work with this one. Or you go along with the professor for the rounds. Or you work along with the professors or something like that. I don't know, integration is a very big topic, and you will have a lot of opposition, lot of this one, that one. But you have to develop a model which is suitable for everyone. Otherwise simply saying integration is not going to be right. Okay, so telenursing is very practical because you require only gadgets to get connected. You require little training, and you should have the frequently asked questions and what answers to be given. And the concerned specialty doctors have to support you because some questions will become extraordinary. You may not be able to answer. So this is one thing. And government should give standing instructions that you can do these things through telenursing. Otherwise they will say legal problem will come. In telenursing they won't like that I did like this has happened. So standing orders, which are all the ailments you can heal and what instructions you can. So complete proposal has to be given so that legally you are safe. Otherwise they will say, oh nursing informatics specialists or robotic nurses and so many other technologies are coming, chemotherapy nurses. Like that you can have modular courses which will make you employment quality assurance nurses. Every hospital is undergoing either NABS or a Kerala accreditation or Gayatri. But we are not trained. There is a nurse quality managers should be there. So you can develop a course and prepare nurse quality managers who will be responsible both in the college as well as in college. You will be under NAC accreditation. Now NABIT is going to come. So you need to have quality managers. Otherwise you will be doing this work also in addition to your teaching work. So you can develop a cadre quality managers, infection control nurses. We don't have authorized courses for all these. So we can have, and in every 100 beds there should be one infection control nurse. Nurses are not prepared, they are learning on the floor. There is no uniformity, there is no standardization. These are some of the areas which you can develop. School health nursing, infection control nurses, quality assurance nurses, nurse informatics specialists. These are all some of the lactation consultants who will consult, see, after the mother gives birth to a baby, then only they see the breast. They see flat nipple, inverted nipple, cracked nipple. They are not able to feed, give artificial feeding, end up breastfeeding. So you have to prepare them antenatally onwards. Antenatally onwards you prepare the mother, so you help in the labor room, you help postnatally also. So this is the role of a lactation counselor. And you have to guide them up to 2 years of age, when to wean, what to give. They are not appropriately nourished. So what happens? They all eat junk food. Junk food. By the age of 2, whatever adult is eating, the child should eat. So the process should develop like that, not giving junk food. And school children, when you take, you must learn, teach them to cook and eat, not ordering in Swiggy and Zomato. So these are all some of the changes you can do. So what else? Yes.
You said AI can be used in many teaching practices, but what if we use the AI to, instead of our medicine practice, we will use of those?
No, we will not lose your job. That is what I am saying. In nursing alone, we will not lose your job. A lawyer gives you advice. AI will give, you are having this case, these are all the law applicable. You can defend like this, it can even draft you and give how to go and argue in the court. You can argue for yourself. But nursing is not like that. Nursing you want to give care. How AI will give care? Artificial intelligence is method of working, smart ways of working. It will never replace us. It will enhance the quality of care, accuracy of care, and how to give it better. So it will not do that. So you can use, one thing is use of artificial intelligence in nursing. You can fine-tune the nursing procedures using artificial intelligence. Like you can develop VR models. VR models is all the nursing procedures, rights to be insertion. Like Maruti car, you see, Maruti car, first they teach you to learn virtually on a simulator. Then they put you on the road. Similarly in nursing also, you can have artificial intelligence supported VR enabled procedures. That means here you put the rights to, it will give the feedback. Okay, you are going rightly, you are going in there, you are going into the Shakya, you are going here, you have not checked this case. Like that you can do all the nursing procedures, you can make it as virtual reality. So what will happen, when the student is inserting the rice tube into the dummy, it will show in the screen whether they are going into the esophagus or into the trachea, whether they are following the step or not. Similarly, catheterization, IV cannulation, all the procedures you can do through virtual reality. That is called virtual reality and artificial intelligence. So you can develop AI guided VR enabled nursing procedures. So that will increase the time. You learn endotracheal intubation through virtually guided. It says that okay, you are holding like this, you are going in there, you are doing like this, you have not selected appropriate blade, you have not done this one. The student learns here, then she goes and does it. And especially this can be done for rare procedures. Rare procedures. How many of you have seen cord prolapse? I have seen in my lifetime only 2 times. So this kind of opportunity for cord prolapse is here. How you will manage obstetrical emergency. Now part of Ayushman Bharat community health wellness centers. They have created a new job called CH, Community Health Nursing Officer. There you will be posted in remote area and independently you have to manage. How do you increase your competency? You should be learning letters, what emergency will come in middle of the night, nobody is there, how will you manage? That you have to learn here through virtual reality. In virtual reality, you can set up as a patient coming, suddenly having abruptio placenta, you are alone, how will you manage? These kind of scenarios can be created and you can train for emergency management. Cardiac arrest, obstetrical emergencies, in school health, suddenly some child develops seizures, some sports injuries. How you are going to manage all these? For all these, competency is very, very important. You must be capable enough of decision making and doing these things and get the patient and family satisfaction. They should give that yes, they are doing well. That is the ultimate. For that, you require the competency development. That is possible with the technology. Technology will find you. The CPR mannequins are like that. When you are compressing, it says, oh, you are supposed to compress 5 centimeters, you compress only 3 centimeters, press a little more. Like that, it gives, oh, your number of compressions are not correct. It gives the feedback. No? Similarly, you have to do for all the procedures. All the procedures they have to learn. This is called virtual reality and artificial intelligence enabled. And we can create avatars. Avatars are AI patients. You can create AI patient, difficult patient. You want to break bad news, death if somebody is dead. How will you do it? You make them practice here. You want to break the bad news of cancer. You create a patient. So you can create AI avatars and then the students can learn talking to them. And this avatar will be a difficult person. So then you start practicing. I learned that way that I told you that I had one session managing a difficult environment. So like that, these are all some of the suggestions which I gave. You can come up. Yeah. So artificial intelligence can be used for developing the competency among students. So AI enabled development.
We could generally use it for planning of care. For example, if I'm planning a care for a patient of epilepsy, so AI could suggest the list of nursing diagnosis. It may suggest the intervention implementation from where I can choose which intervention I am going to use. As we all know, all the hospitals are equipped with computers and systems. So it is easy to apply this kind of technology.
So AI based disease management or something. I told procedure, you can manage the entire patient. The patient comes for a CA. So day 0 to day 9 they are getting discharged. So what care you will do? You can do based on artificial intelligence and you can improve that how you can reduce the length of stay. These are the value added activities, these are the non-value added activities. All these you can reduce. This is called the Lean Six Sigma. Lean Six Sigma means avoiding reducing non-value added activities. For example, if a patient comes with low hemoglobin level, anemia, 160. When a person comes with low hemoglobin level, what he expects is the hemoglobin level has to increase. He is not bothered how many ml of blood you have taken, which lab it is going, what machine is there, how old is the machine, how long it will generate the report. These are all not his concern. I gave my blood, I want to know what is my hemoglobin level. How quickly my hemoglobin level will increase. These are all the patient concerns. Rest all are non-value added activities. So each of the activity, this is called value stream mapping. You can do value stream mapping and reduce unnecessary nursing management. What the patient expects, what you are doing, what are all the non-value added steps which you can reduce so that you are able to care for the patient quickly. For example, Indigo flight. What Indigo says, Indigo always on time. Because Indigo is on time, now all the other airlines are on time. How they are able to manage? Initially, we have to, one flight comes, it will take 3 hours to fly next time. Now one way passengers are going, other way passengers are taken inside. That means air hostess are collecting their waste. Earlier days air hostess were not collecting the food waste. There was a separate team. Whereas there were additional responsibility here. This is called task sharing and task shifting. Task sharing and task shifting is, see, as this is connected with the telenursing clinic, nurses clinic, independent practice, all these. discharge here. A preterm newborn is discharged to the community. They say that okay, you can take the baby at home. The mother will have 1,000 doubts and at least 100 wrong practices. You are in the community, you can follow them up and you can increase the thriving of the baby. Survival. That is thriving to survival, they say. Hospital makes them to thrive, but they should survive. They die. After going home 1 month, the preterm baby dies. You can protect that. You can show that. So I am telling you, there are sustainable developmental goals. SDGs. It says IMR has to be done. Kerala is always on the higher side. So what are the good lessons? You adopt a neighboring state and you can support it. Or in your own state where it is not there, how as a nurse you can improve the sustainable developmental goals. That also you have to. Sustainable development goals are improving all the MMR, neonatal mortality rate, disease burden. So many indicators you can take and you can improve. Water and sanitation, hygiene in a village. You bring the change and then show them this village we have adopted from private nursing, from community of nursing. This is the change we brought. You can say wash is water and sanitation. You can improve the water and sanitation. Look at the menstrual hygiene alone. There are domestic workers. Domestic workers, how they change their character. I was asking my own servant, then she was telling me, she's traveling 1 hour distance and coming, she's telling me, no toilet, where do I go for toilet? How many houses think of toilet for someone? Menstrual hygiene for their son, construction workers. These are the below poverty line people who are not having basic facilities. I gave the sanitary bags to the construction workers, I donated. They don't have sanitary bags. Construction workers, migrant population, AIDS is really developing, a lot of construction families are there. So many families, ladies are there. No sanitary bags. Similarly, domestic workers. Every house is having domestic workers. Your houses also you will have domestic workers. Have you ever asked them how they are managing their urination, defecation and menstruation? How many of us have provided? These are the basic needs. You see the Maslow's hierarchy of needs. This basic needs to the BPL population, unorganized sector. So you can improve the health of the unorganized sector. These are all unorganized sectors. They don't have association. If nurses have problem, you have association, you have your council. For them, who is this? This one measure is okay. Next one is improving the first aid capacity of the people, first responders. Auto drivers, taxi drivers are only called when there is a heart attack. Some may be in Dubai or London or Canada. Nobody will be here. So you have to train the auto drivers and taxi drivers in compression only life support. Compression only life support is no need to give birth. Not to make breathing if you want to do people think I'm advanced or otherwise. So compression alone is it. So you can take an initiative, train all the students in compression only life support, and you train all the taxi drivers, you train all the police people, you train all the auto drivers, liaison with the auto drivers, liaison with taxi, liaison with Ola, you liaison with Uber, and train all of them in compression only life support, and say that we have trained this many people in compression only life support. Otherwise, take schools. All school children will teach compression only life support. Teach it to elderly children, maybe 11th and 12th or after 8th standard. So you say that we will take this many school children and we will train them in compression only life support. Some of the basic. See, I am telling you, we have got a lot of skills and we have a lot of human resources. Our system number 1 populated country. You know that we have crossed China last month. So we are as of now 142 million in population. So you can take a mission, each one teach 10 or each one teach 100. Now 100 of you are there. If each one teach 10, you can teach 1,000 people. Similarly, how many nursing colleges in India? 300 nursing colleges. 300 will have minimum 200 students. So 300 into 200 is how many students? And lives you can say. Are you able to understand? So you give a mission like that. Each one teach them. So we will teach this and we will bring the changes. This can be for compression only life support, or it may be for dental hygiene, or it may be for menstrual hygiene, or it may be for diabetic NCD complication prevention, or it may be cancer screening, whatever it may be. You take this one. Each one teach 10 mission. You want to adopt only 10 people and teach them something. Or each one teach 100. Something like that. Give a mission. Then you can do something like that. See, don't make limitation. 3, they can go beyond this. Minimum. So you want to go? No. Any other suggestion?
Last year, August 1 to 7, it was conducted as celebrated as Breastfeeding Week. But the things I saw from my technical posting is that at the present time, the young mothers are feeling shame to do proper breastfeeding. They will lose the structure of their breast. That is the main problem which is faced. And I also seen one case which was from a family member. She was not knowing that she was not giving a proper
Okay, I
breastfeeding.
understand the problem. Because of time constraint, I am just interfering. I'll tell you, National Family Health Survey is published every 3 years. Fifth report was published in November 2020. Fourth report was published in 2016. That time, initiation of breastfeeding was 40%. Exclusive breastfeeding also some similar percentage. So why this is happening in India? So you have to say initiation of breastfeeding is purely nurse's responsibility. Because we are only delivering either labor or normal labor or a so you can say that, we will show that our initiation of breastfeeding is 100% in Kerala. We are going to take up that responsibility. So take up that responsibility and have training programs. The students can take up, the hospitals can take up, at least wherever the colleges of nursing are there. Attach this hospital. We will show 100%, not 100%, at least 90%. So from 40%, Kerala is going to initiate breastfeeding to 80%. You give that metrics. This is how we are keeping the indicators. We are going to improve this one. Initiation of breastfeeding. Exclusive breastfeeding also you can do through mobile app or telenursing. So you say this one, initiation and exclusive breastfeeding through telenursing and follow up from antenatal to postnatal and further follow-up is one thing. I have already submitted this project to Bill Gates Foundation. So this way you take it and we can design structure, educate, and then you can do. So you can show the metrics, we can improve initiation of breastfeeding to. So that is one area. Similarly, so many other areas we can take and adherence to family planning, adherence to whatever it is, the treatment protocols. My specialty is OBC. So I give a lot of examples from OBC. You can take examples from all the other specialties also. Immunization. Kerala is having good indicator. But the nurses have to take the ownership. But we did it. You have to show with the number. Before and after. So in between you have an initiative. So all these initiatives you can show. Excellent. Please applaud for that. You know, you ask for undergraduate research support funding and for startup. If you want to set up a telenursing clinic, startup. Engineering colleges are given funding to the job. They give 50 lakhs for startup. So you need money. This is how you do it. So you have to ask. So you get undergraduate research funding. Earmarked fund for undergraduate. Yes. So you ask for earmarked funds for nursing research, not only limiting to undergraduate. Give classifications, who is documenting, you are limiting person, dedicated earmarked funds for nursing research, and that is for UG projects, PG projects, and independent nurses. And that faculty and independent people also can apply and do the research. So ask them to give some budget for nursing research. Good. I got 50 lakhs now for faculty. And undergraduate they will 2 lakhs per project. Because it was already there in the they will not know where they have to support you. So you have to give, that is why the success of this one. So you can ask earmark the funds for promoting nursing research. In that, students research, UG, PG and independent research. They will earmark the fund, they will put a committee, they will follow up, all those things. Now we are giving only broader idea. This requires further breakdown. See, there are two things we should understand. One is strategy, other one is operation. Strategies are ideas. Operations are how to make it practical. Step 1, 2, 3, 4 like that. For example, you want to make biryani. Biryani is a strategy. You cannot, like this you cannot make biryani. You have to have ingredients, you should know the method to cook, you should cook it correctly so that biryani comes onto the table. So that is operations. So having biryani for next meal is the strategy decision. So now you can give only strategy. Operations you have to work out for each one. How you are going to make biryani. Okay. Understood. So operationalization they will help you. Yeah. Excellent idea. See, you have to have faculty development program. They have to give money for faculty development program. Your faculty should go and learn and for example, robotic surgery is come. There should be money to train the faculty so that they teach you. So you put faculty development program. Faculty development program, research, earmark the funds for nursing research. What else? Telenursing clinic, school health clinic. Nursing informatics is one area because every hospital is going to go on electronic health documentation and every national health mission and everybody is going to have already NHM is on digital ones. Whatever you do here, accident where it is happening, sitting in Delhi, they know. They have that accident and emergency informatics system. They log in here, they get the data, how many accidents, how many died, how many survived, how many mass casualties sitting in Delhi, NHM knows. We are only giving the data. So nursing informatics specialists have to be there.
According to us, we are only getting the to only for deliveries and others. We have enough experience to skill development, delivery, won't get even enough experience for it.
Competency. That's what this AI-based procedural development, AI-based patient care, that will increase the competence. Then you have to practice on the patient.
Most of the students, they focuses on only on the theory basis. They forget about just they need to say and they need to teach. They don't care about our clinical practice or anything.
Yes. That should be something intrinsically. Like, so they have to say that this many competencies that they are capable. Some competency mapping can be done. Students' competency mapping system. And the exit exam is going to come. Exit exam should not have only theory and MCQ. It should have a skill component. Then you say that exit exam, if it is coming, it should be skill-based exit exam. That is exciting. Otherwise, again, multiple choice questions will come. So when patients come also, they will give multiple choice questions. If patient chooses correct answer, you will get correct repeat. And multiple choice question, you don't know which is your answer is correct or not. So when we were students, we didn't have multiple choice questions. So we were taught only correct one. So our brain is having only correct. Current generation is having 70% wrong answer, 20% right answer. What care they will give? What is the assurance that it will not give 75% even wrong care? Because you are teaching 75% wrong answers. Many coaching centers, they are taking money. You know, coaching centers are taking money. And they are teaching you 75% wrong knowledge and 25% somebody works for 5 years, give 2 years leave. They will want to come back. I went on sabbatical leave, 2 years I went to Dubai. I came back, I built a house. And my requirements are over. We don't have what you want to do. You know, too much money, what are you going to do? So if you talk to the nurses who are sitting abroad, many of them will be wanting to come back. They don't have money to give job. They need some money for maintenance of life. So reverse migration. But let us go abroad. Nothing wrong. So that's so by the time they reach the final year, because lack of time I could not talk many of the things which we have done. So then by final year you are already going to ready. So like that you can integrate a healthcare communication from first year onwards, so that your migration to English speaking countries will be time intensive. And now Germany wants nurses, and Japan wants nurses, China wants nurses, but all of them want their language to be here. Germany language is very tough. You require at least 2 years to learn. So what happens in the first year itself, they have to identify which country they want to go. Then we give an additional in the language training, India, China, Japan, and we give healthcare occupational English for IELTS service. So it will help to for higher education of our job. So that also side by side with the parallel education I was telling you. So this is how parallel education opportunities. These are all the parallel education opportunities. Parallel education is apart from your degree, apart from Indian Nursing Council curriculum, you are gaining additional skills. That may be in OET. So that in that program you are able to apply for OET, your license is ready, you are ready to fly.
There need to be policies and law enforcement in terms of making sure that
Work as India have got only an opportunity and exposure to the patients. Those are presented to a hospital. Those are having good finance or any other policies. None of us are not having a much exposure to the patients. Those are in palliative care, in house itself, bedridden patients. None of us know that how to do a catheter cleaning without a catheter set in a household setting. And I am having two doubts. Why so if any college is getting an opportunity to adopt some patients near the college and doing the pain and palliative, and also support from the government. Why? Because means only the government resource
That's not the nurse clinic, palliative care clinic.
also government, if the government employees are just visiting once a month, if we are also supporting,
Nurse-led palliative care centers.
if we are also supporting twice a month, they will be getting a visit from our side and from government side, and we will be getting an
Nurse-led
exposure.
geriatric centers we can have. Daycare, Alzheimer's patient is there, or they don't know where to leave anymore. They can come and live here and go. Nurse-led pediatric care units also you can have, either as a daycare center or admitting. And anything else, because everybody can speak. Few people are speaking frequently, others also can.
Mainly nowadays we are using mainly focusing on documenting rather than providing hands-on care. So to reduce this problem, I thought that
Electronic health records.
in case every action should be documented. So we are unnecessarily wasting time.
That's what electronic health record means. You treat options will come. So you can put digital signature with all you have done.
One of the signs we have is that none of our colleges does not focus on our mental health or anything. They just give pressure, continuous pressure, and nothing else. We are suffering a lot. But
Very good, excellent, excellent. Now, mainly everything, we have a wellness program, which is called the happiness program. So in this 10 sessions are taken every year, how to remain happy. So you can have wellness clinics where the students can approach, and wellness lessons are taken. So you can have happiness sessions, and we have wellness centers.
these counseling sessions are there, but it's just for this as a normal routine. They are not trying to bring our brain. They just need to do as a routine. Maybe some points.
good relationship with you, you will not tell your personal problem. So the psychiatry and psychology department, they have set up the clinic. We represent there and they do. So you need to have external people in here. They will not open up to you. They will open up only very limited way they will open up. Real help will not happen. So even if it is weekly once, you can have a happiness clinic or a wellness clinic where it's something like that. You see, they will bring into the system. So they may have, like you see, every Wednesday in maternity centers they have yoga therapists coming and teaching yoga for antenatal women. How they have implemented? They do in Tamil Nadu, if you see every Wednesday when yoga therapist comes and all antenatal mothers are asked to come and she teaches yoga. And she is paid on an honorary basis and honorary means paid. So you can, they will create ad hoc posts for the counselors so that they can concentrate on this wellness, happiness, suicide, a lot of suicidal tendency, prevention of suicidal ideation.
And it will full
You have that in Canada, Canada they are doing it, they are doing the other country, they can do it for the central government also. Yes. So all these you can give in suggestions. Placement career guidance program has to be conducted for the final year students. So they should learn how to write a CV, what are the opportunities, where all they can go. Not only that, after going there you undergo a lot of harassment. I heard that some letters are from going to Kuwait, the agent has taken some 1 crore rupees, 65 lakh rupees. Why you have to lose that much money? So I still remember when I went to Kuwait, I paid 65,000 to them. This was in 97, Madam Sridevi is there. 65,000, that time my salary was how much? 7,500. Every month salary you have to take and give. You burden the parents. Whereas when recruitment is free, the hospital pays the recruitment agency and students are getting exploited. Parents are getting exploited. So to prevent that, you should have that all the recruitment must be made free. Overseas recruitment. That way also that some kind of exploitation. So if a career guidance program is there, government approved agencies will go via them. So that awareness should be created. Somebody from here, you were only talking in the last chance.
Interactive programs should be promoted.
So that can go into one suggestion. At least twice in a year interaction with a subject expert or the experts apart from your own institution. So that this is called cross learning. Cross learning is I learn from you or you learn from me. So cross learning opportunities by inviting external experts at least twice in a year. Brainstorming sessions twice in a year. Brainstorming sessions twice in a year can be given. Nice, you know, you're all wonderful at it. I'm not telling for name's sake. So many ideas you are having. Now each one of you, I am seeing you are thinking. Yes or no? You are thinking what you can contribute to your state. What you can contribute to your profession. Have you started thinking that way? Now this is the trigger. That is the way. And you are all having brilliant ideas. Brilliant ideas. So you are only going to make the future. And your government is so supportive. There is no government in entire India who has organized such a program. I am also attending for the first time. So they are grooming student leaders. Make use of the opportunity.